work session on returning to learn. Today's work session will be led by Rachna Sizemore-Heiser and Stella Pekarsky. Prior to handing the meeting over to them, I do want to take roll call so that everybody watching is aware of who is participating in this session. So Dr. Anderson.
Present.
Ms. Cohen.
Here.
Ms. Derenak-Kofax.
Okay.
Mr. Frisch.
I'm here.
Ms. Keys-Gamarra.
Here.
Ms. McLaughlin.
Here.
Ms. Marin.
Present.
Ms. Omesh.
Here.
And you've already seen Ms. Sizemore-Heiser. Ms. Tolan. Ms. Boateng. So we will go ahead and proceed. I'm going to hand the session over to Ms. Sizemore-Heiser and Ms. Pekarsky so they can do the appropriate introductions, and we will make sure that when Ms. Derenak-Kofax and Ms. Boateng join up,
I am here, everyone. Hello.
Glad you're here. So when Ms. Boateng joins us, we'll let people know. And I do see that Ms. Tolan has also joined us. With that, Ms. Sizemore-Heiser, would you like to do the introductions?
Sure, Ms. Pekarsky, are you fine with that?
Of course, go ahead.
Awesome. So today's meeting is about reviewing FCPS's plans, initial plans for a return to school scenarios for the fall. And so I'm just going to very briefly frame the conversation and expectations for today and then turn it over to Dr. Brabrand to present the initial plans. The purpose of today's meeting really is to look at our big picture plans and options for the fall. We have representatives from our Fairfax County Health Department with us to discuss the health concerns. And then we're having another work session on June 23rd to really discuss more of the details of how the plan will work. So, the outcomes of today's meeting is not a vote, but really to try to build consensus around the plan that we will use going forward in the fall. Obviously, things may change and guidance from the health department may change, but these are our best thinkings for right now. So having said that, we will have about an hour, I believe, for our staff to present us their plans, and then we will turn it over to school board member comment and questions. So anything else, Stella, you want to add before we turn it over to Dr. Brabrand?
No, I just wanted to say thank you. I know there are lots of people watching today. There's been a lot of angst. I want to thank Dr. Brabrand and staff, and also I wanted to introduce our two doctors from the health department, Dr. Benjamin Schwartz and Dr. Gloria Adoyensu. I'm sorry if I butchered that last name. We're very happy you're here to join us today, and we're very we're looking forward to the discussion. So thank you, and let's take it away, I think.
Yeah, thank you to the staff for working so hard on everything. And I know our everyone out there in the community, as well as we are very eager to see the details of your plans. And so with that, I'm not going to take any more time on the introductions. I'll turn over to Dr. Brabrand to start our discussions.
Well, thank you, Ms. Sizemore-Heiser and Ms. Pekarsky, Chairman Corbett Sanders, and members of the school board. We're thrilled to be here this afternoon and really present to you our return to school plans. We've spent a lot of time working very hard with our return to school task force to gather input and feedback, and we're delighted to present. You're going to hear briefly from myself and then from Dr. Francis I, our Deputy Superintendent, who's co-chairing the reopening of schools with me. Then we'll be turning it over to Dr. Presidio, who has really been helping spearhead with Dr. Ivy and myself the return to school with other action team leads. You'll also have a chance, as you already heard, to hear from Dr. Gloria and Dr. Schwartz, and we're thrilled to have the health department, who's been a wonderful partner with us from the beginning of this journey with COVID-19 and continuing to work very closely with us as we begin to look at how we reopen our schools in a safe and effective manner. And then you'll finally hear a little bit from Ms. Burden, who is our Assistant Superintendent for Financial Services, as we look not just at these plans, but how we can begin to budget as well as we can with limited funds around some of the things that we need to do to be prepared for return to school. So I'd like to go to the first slide, our work session outcomes. If we could call back up the presentation, our reopening of school draft plan. What is our work session outcomes? First, we want to provide information from federal, state, and local health department on criteria and guidelines for reopening schools. As you know, the governor shared his reopening schools plan last week. And now a week later, we're bringing you our best thinking, our collective best thinking from both federal, state, and local health department folks and from the governor. We're going to review our reopening school scenarios. We shared them with you broadly a few weeks ago and with the community, and we want to share that in more detail this afternoon. We want to provide the board and the community a timeline for our key decision points as we begin to make the decisions about how and when to reopen our schools. And then we want to leave time, critical time for school and questions so that we can be fully prepared at our next work session next week to follow up and address any outstanding concerns. And without any further ado, I'd like to share and introduce Dr. Ivy, our Deputy Superintendent, who will begin our introduction of this plan. Dr. Ivy.
So thank you, Dr. Brabrand, and good afternoon, all members of the school board. If you could turn to the next slide, thank you. Following the May 11th Fairfax County School Board work session, where the board considered initial fall reopening considerations and challenges, we recognize that the development of specific plans and preparations for opening schools in the fall of 2020 would require cross-collaboration and planning between every department across our division in conjunction with our various county offices and community stakeholder groups. So Dr. Brabrand and I, along with Dr. Presidio, established a new task force structure to prioritize and expedite information gathering and to develop recommendations under 3 potential scenarios: virtual learning for all, in-school learning with health and social distancing, and online learning for individuals with medical needs. As a part of our task force work, we identified action teams to address 6 key components in preparation and planning for the reopening of schools. Those 6 key components are facilities and school operations, instruction, technology, communication, community partnerships, and human resources. Division leaders, who are listed on this slide, were assigned to oversee the work of each action team. And these teams met daily and often worked around the clock with additional members of their teams who had expertise in these areas to identify critical actions. They produced an incredible amount of work in a very short period of time, with the added complexity of our ever-evolving and challenging tasks. We are very appreciative of all of their efforts, and their work will continue as we develop more details and specifics to our plan moving forward. You could go to the next slide. Our broader task force consisted of 55 members who represent a wide range of diverse stakeholders in our community, county, staff, and students. We've held 6 meetings thus far where our action team leads shared their considerations and recommended critical actions to the larger task force to gain input, suggestions, feedback, and to answer questions about their critical component for reopening. Members of our task force include staff representing classroom teachers and FCPS professional organizations, including Fairfax County Federation of Teachers, Fairfax Education Association, Association of Fairfax Professional Educators, and Support Services Employees Advisory Council. Parent representatives on the task force are from the Fairfax County Council of PTAs, Special Education Parent-Teacher Association, Parents of Autistic Children, and Title I Parent Advisory Council. We have representatives from our school board advisory groups, including the MSAOC, Minority Student Achievement Oversight Committee, and the Advisory Council for Students with Disabilities. We have our staff from the Fairfax County Health Department and from various departments across our FCPS offices. And we've had school board members and our school board student representatives, both our current school board rep and our incoming rep for the next school year. And lastly, our region and school leadership, including principals from each level. And we'd like to just say a sincere thank you to every member of the Reopening Schools Task Force for their time that they have provided us and that they will continue to provide us as we move forward in defining and refining our plans for reopening school. Your feedback, your input, your questions, your challenges have been very helpful in guiding our work and help us to consider the impact of every recommendation and decision that we made. So we have one more slide I'd like to share with you today, and that is that we want everyone to know of our 5 principles that have guided our work from the very beginning and influenced our current and future planning for reopening our schools. And they are, first and foremost, ensuring safe learning and working environments for students and staff. Secondly, we want to maximize in-school student learning experiences as allowed by state and health guidelines. We want to ensure that all students receive instruction that meets state and federal guidelines and that every student has the necessary support for success, to include access to technology and connectivity, social emotional wellness and health supports, and additional supports for our most vulnerable students, including our students with disabilities. Providing training, time, and support to our staff to prepare for a successful reopening. And lastly, making sure that we are providing to all families and staff proactive and clear communication with translations. So at this time, I'm going to turn the presentation over to Dr. Presidio, who will share more details of our recommendations for the reopening of school for the 2021 school year.
All right, thank you very much, Dr. Ivy and Dr. Brabrand. And I am getting a little bit of feedback on the microphone here. So just as a reminder to all the folks that are on our call, if you could please mute your microphones, and that will help with any feedback that we might be getting. But again, thank you very much, Dr. Ivy and Dr. Brabrand, and good afternoon to all of the members of the board. It's a pleasure to be able to present our proposals for reopening schools with you today. Before we actually get into taking a look at the different reopening scenarios, though, we did want to discuss a little bit of work that we've been doing to really try to understand some of our challenges and successes that have occurred during distance learning this spring. And we think it's critical to make sure that we're focusing on these lessons, to make sure that we're really developing a very responsive reopening plan that's going to meet the needs of all of our students and staff. So to start out with, we are currently in the process of conducting staff and family surveys, and we really hope that we're going to have a high response rate on those. So we would really encourage our staff members and our family members to complete those surveys, because that information will be used to help inform our lessons and be able to provide more information to the board on the June 23rd work session. But even before the completion of those surveys, we have conducted a number of different focus groups, and we've received feedback that is helping us kind of frame these lessons learned and to frame our proposals that we're sharing with you today. And the first area that I'd like to focus on is around our instructional model. And I think the biggest thing here is that we've really learned the importance of consistent implementation division-wide of our instructional schedules. It's really important that all of our schools are operating consistently with the same expectations that we have division-wide. We also know that there's a need for more synchronous student learning in any future distance learning or virtual learning scenarios that we might find ourselves in. And we've heard loudly from our parents that increased access to live teaching or synchronous teaching really helps support and reduce the family burden for providing direct instructional support to their students. We also have learned that we need to have increased social emotional learning opportunities built into any virtual learning environment that we find ourselves in. Even more importantly, we've learned a lot about equity issues. We know that technology and connectivity have to be provided to everyone in the division if we can make sure that all of our students are going to be able to participate equitably in distance learning. But even more importantly, we've seen really the disproportionate health and economic impact that COVID-19 has had on certain segments of our community. And that additional economic and health burden has really strained our students' abilities to participate equitably in distance learning. And we're going to talk about some mitigation strategies for that as part of our reopening plans. Additionally, communication has been very important. We've learned that we need to have more two-way communication, not just one-way pushed out information from the division, but more opportunities to engage with our stakeholders in discussion and dialogue. We've heard from our PTA associations that we need frequent and consistent messages across the school division, and that we know that all of our communications, they've got to reach all of our families. So that means that we need to have oral interpretation and written translation services available to families who require them. And we want to make sure that our return to school success stories are also shared in the media. That's really important because we have so many folks in the school system that are working so hard on behalf of students and families that those stories need to be told. Additionally, as part of our focus groups, particularly with the superintendent's teacher advisory committee, we've learned a lot about instructional practices, technology needs, and staff support. And on the instructional side, we know that teachers need dedicated time to plan and work with their collaborative teams. And this is particularly true when any type of virtual instruction is necessary. It takes more time to plan for virtual instruction, and that means teachers need adequate time to be able to plan for that instruction. We know that we need to provide more professional development on virtual teaching strategies. We need to ensure that we have integration of digital citizenship skills and concepts into our curriculum. And we need to make sure that we're consistently including specials at the elementary level and electives at the middle school level. And those courses are really important for a whole child approach to education. And then, of course, thinking about next year, we need to think about updating our grading policies to make sure that they're really incentivizing and supporting student learning during any type of distance or virtual learning environment. On the technology side, in addition to ensuring one-to-one devices and connectivity, we know that we need to have a learning platform and a video conferencing platform that's reliable and stable and can support the division's large user load needs. And we also know that we have to have secure ways for our students to access those synchronous learning opportunities. And we also need to protect and honor our students' individuality while still maintaining security. And on the staff support side, we're learning more and more about the staff challenges that staff members face with childcare access and the need for continued professional development on a wide range of issues, even outside of instruction, but also on health, safety, and self-care. And then finally, we need to make sure that all of our teachers have consistent access to the internet and high-speed internet. Additionally, we've been examining lessons, obviously, at the local level, but we've also been monitoring what's been happening at the international level as schools around the world have reopened. And, you know, unfortunately, there's not really any international consensus yet on best practices, but there are some similarities that we can see in the way that many schools around the world are approaching reopening. So here we provided just a brief summary of several different countries based on a research study that was done by one of our research partners that looks at some of those practices from around the world. And with respect to things that are similar, you can see all of the schools listed on this chart are reducing their in-school capacity. That means reducing the percentage and the number of students that they serve in school at any one time. They're also all enhancing their cleaning protocols and their social distancing protocols. But again, we do see countries taking different approaches to different practices like health screening, health monitoring, the use of PPE, and different instructional models. But still, nevertheless, we believe it's important to keep an eye on what's happening around the world, and we're going to continue to monitor these developments and use this information to inform our reopening plans as we get ready for returning in the fall. So next, what we'd like to do is provide a little bit of information on Governor Northam's guidance that was released just last week for reopening Virginia's schools. And it was on June 9th that Governor Northam announced a phased approach to reopening Virginia's schools. And really, the school reopening phases are similar to what's happening in the broader community and business reopening in the Forward Virginia blueprint. So in addition to the phases, school divisions learned that we are going to be required to deliver new instruction for the next academic year. And we're going to be required to have community mitigation strategies like physical distancing, enhanced cleaning in all of the phases of reopening. And then school divisions do have flexibility to be more limited than the state phasing with respect to in-person instructional offerings. And that needs to really be based in terms of decision-making on partnership with local public health officials and using local public health data. So this chart basically attempts to summarize the key elements of Governor Northam's 136-page reopening plan. And it really emphasizes the three different phases of this plan. So first, for example, you can see that permissible in-person instruction is allowed even in phase one, which technically, and I'll speak to this more in a minute, technically we're in phase one in education right now. So in phase one, you are permitted to have in-person instruction in really, really limited situations, just in special education programs with limits of 10 students in a particular room. You're also able to have childcare provided in the schools for working families. In phase two, then you see that in addition to serving special education students, we can serve preschool students through third grade and English language learners, and we could have summer camps in school buildings. And then by the time we get to phase three, you see that we have the ability to serve all students in person as long as they can be accommodated with social distancing measures. And that, of course, might require alternative schedules that would reduce the number and percentages of students attending in school in person at any one time, and might require a blended approach of in-school and distance learning. Also, you see the limitations on gatherings. In phase one, there's a limitation of 10 students or individuals. By the time we get to phase two, there's a 50-person limit. And by the time we get to phase three, there will be updated executive orders and more information coming on what the actual numbers would be with respect to how many individuals would be allowed into a particular school building at a particular time. I think the next item is particularly important to note. You see in phase one for social and physical distancing, the language from the governor's plan prescribes 6 feet of distancing maintained between desks, tables, workstations, and between students and staff to the greatest extent possible. But you see that when we get to phase two and phase three, the language becomes less restrictive, and you're encouraged to have 6 feet of distancing to be maintained to the greatest extent possible. With respect to groups, we need to restrict mixing of groups in phase one and phase two, and we need to consider doing that in phase three, and adjusting schedules as necessary. And then for activities and athletics, they're prohibited in phase one. We get some flexibility by the time we get to phase two for limited participation, and then phase three is still to be determined. And the same thing with respect to communal spaces. They're closed in phase one. They're closed in phase two unless we're able to stagger space use, and phase three is yet to be determined. There's some additional information we wanted to share about the governor's plan, and the first point is really important. The state plan bases their guidelines on following the CDC guidelines. And everything that you're going to see in our plan is directly based on the CDC guidelines and decision rules. Additionally, the state plan requires school divisions to conduct daily health screening of both students and staff for symptoms and history of exposure. It allows that to be done with self-reporting forms, and that requirement is in effect for phase 1, 2, and 3. Also, face coverings need to be worn by staff when 6 feet of social distancing can't be maintained. And face coverings are encouraged to be used for students as developmentally appropriate and in settings where social distancing can't be maintained. And again, those guidelines apply to phase 1, phase 2, and phase 3 as well. And then finally, prior to entering phase 2 and phase 3, school divisions are going to be required to submit reopening plans to the state. We just received that state template on Friday, so we have not submitted a plan yet, but we will do so shortly. And once that plan is approved, then we could move formally into phase 2. But that plan has to include strategies for mitigating COVID-19 risk, and also our plans for instructing new content and addressing the learning loss that may have occurred during our school closure period. Also, we learned that we can seek waivers from the 180-day or 990 instructional hour requirement and the 140 clock hour requirement, but we cannot seek waivers for SOQs and SOAs that are going to require us to continue to teach the same state required content and provide the same state required services. We're also going to be required to take attendance and to grade work. So with that, the state plan, again, really does place a heavy emphasis on local authority and looking at local public health data with respect to reopening decisions. So we're very excited, again, and happy to have our colleagues from the County Health Department here with us today. I'm very happy to introduce Dr. Gloria and Dr. Schwartz, who are going to help us with a little bit more information about some of the COVID-19 trends and some of the mitigation and suppression strategies that are currently being used in Fairfax County. So I will turn it over to Dr. Gloria and to Dr. Schwartz.
Thank you. Good afternoon, Madam Chairman and members of the school board. Thank you for the opportunity to provide you with an update of the COVID pandemic response in Fairfax. We hope that the information that we provide will be helpful to you as you deliberate on how best to reopen schools as safely as possible. It has been 146 days since we activated our health department's incident management team in response to the outbreak of the respiratory illness now referred to as COVID-19. Public health efforts to control the spread of disease has evolved over time as the outbreak has continued to spread. At the beginning of the pandemic, the focus was on preventing the entry of the virus into the United States, and containment measures focused primarily on travelers and their close contacts. As the pandemic has evolved, control efforts have had to be refined, and certain interventions that were critical in the early stages, such as the airport screening and quarantine of travelers, have become less impactful as transmission has become more widespread in our community. Several months ago, with the restrictions on gatherings and the stay-at-home orders, we moved into a community mitigation phase that seems to have been successful in curbing the explosive spread of the virus and the rate of new cases that would have overwhelmed our healthcare system. As we reopen and move towards our new normal, it is important that we stay the course and maintain these same social distancing and infection prevention measures, such as the wearing of face coverings, hand washing, covering coughs and sneezes, and staying home when sick. And that is because the sheltering in place measures have not altered the underlying conditions that can allow the virus to spread explosively as we resume our normal activities. The virus is still in our community, and the majority of our Fairfax population remains susceptible. So for the next phase, the health department is scaling up our contact investigation efforts while the healthcare system prepares for the potential surge in patients. And this practice of isolating infected people and quarantining those who may have been exposed but are not yet sick, what we call contact investigation. This is a critical part of the public health response to infectious disease outbreak and has been the backbone of our COVID response right from the beginning of the pandemic. However, because it is resource intensive, it has its limitations. And so for us to reopen successfully, next slide please, we need to respond to cases quickly in order to suppress the virus. Our goal is to box it in using the 4 targeted interventions shown here, starting with testing strategically and widely. And fortunately, there is increasing availability of testing, and we continue to work with our community partners and engage in targeted testing in high-risk areas to identify symptomatic and asymptomatic cases. So the next step after, in testing is to identify infected people quickly so that we can isolate them and so that the virus stops with them. And the third step in this strategy is meticulous contact tracing to identify close contacts of those who are infected and then warning those contacts of their exposure and quarantining them for 14 days. The idea to create the idea when this strategy is to create a closed loop so that with each wave of infections, there are fewer secondary infections, and as a result, the virus is eventually boxed in. In determining how we scale up our contact tracing operations, we have looked at a number of models which recommend a contact tracing army of anywhere from 15 to 30 people per 100,000 population. And so our goal is to hire up to 400 additional staff by the time school reopens to ensure that school staff, school health program staff who have been deployed as part of this response are replaced. And our goal for the 400 individuals to do contact interviewing as well as case interviewing, and also to have community health workers, up to 70 community health workers who will help our case and contact tracing teams better connect with our diverse communities and ensure that our community members have what they need to safely self-isolate and quarantine. The box it in strategy is intended to prevent cases from becoming clusters and clusters from becoming an epidemic. How well it works will not only depend on these health department actions that I have just described, but on what we do together as a community, which Dr. Schwartz will now elaborate on.
Thank you so much, Dr. Gloria. And now the next slide, please. So there are a number of different factors which may affect the effectiveness of the box-it-in strategy. So the question I think we all ask is, will this strategy be effective? And will we be able to control the pandemic? And the answer depends on several factors. And I think it's really important that we understand these various factors. First, it depends on the extent to which infection prevention measures are maintained by our population despite the loosened restrictions. And we've all seen pictures of what's going on in some of the other states that had reopened before we had. And it really leads to some questions about whether people will continue to maintain these protective behaviors. Second, the strategy depends on identifying cases by testing. And despite the much greater availability of tests, we have some critical challenges. And they include the number of people who are totally asymptomatic and therefore never will get tested, people who may be mildly symptomatic and may not think about being tested or make the effort to get a test, and then people who may be concerned about the consequences of being tested, such as having to stay home and not being able to go to work. And because of all of those factors, there's really some uncertainty about how effectively the testing can be applied across the entire population. Third issue is the speed and the effectiveness of our public health investigations and contact tracing. And so, as Dr. Gloria has pointed out, the health department is hiring about 400 people to do this. And based on our experience reaching cases during the mitigation phase, which is well over 90%, I think we have some confidence about our abilities to meet this need. By contrast, there are some concerns about the extent to which people who are recommended for isolation and quarantine will be able to effectively maintain their separation from others. Some challenges include people who need to continue going to work to provide for their families, those who live in crowded situations and therefore find it difficult to separate themselves from others at home, and for people who are quarantined, getting them to maintain these behaviors even though they are not sick. So a final key factor is the biology of the coronavirus. We don't know, for example, what proportion of cases are asymptomatic and what percent of disease transmission occurs from asymptomatic people, which makes it a little bit hard to project the effectiveness of this box-it-in approach. On the right part of this slide are the results from the University of Virginia coronavirus model that show the potential impact of changes in behavior as well as the completeness of case detection. And as you can see from those 4 lines on the right-hand part of that figure, there may be very different trajectories of the outbreak in Fairfax County, depending on what assumptions are made. Also, even though the x-axis on this figure is time, and there are dates that are shown, which make it look like a subsequent wave would be decreasing toward the end of August when school might be moving toward reopening. Given all of the uncertainties, I would not put much confidence in these particular dates. Next slide, please. So I'd like to move from describing the control strategy to share an update of the epidemiology of the pandemic. Shown here are some numbers from the Fairfax County dashboard, which is on the county's webpage. Because I needed to share these slides a few days ago before this presentation, the numbers that are shown on the slide are a little bit out of date. So let me give you the newest numbers. Today, there are 13,215 cases of coronavirus that have been diagnosed in our county, with 75 new cases added today. There also have been fewer than 100 confirmed cases for each of the past 7 days. And this compares to between 200 to over 300 cases per day at the peak of the outbreak in Fairfax. So really a quite substantial decline, even in the context of increased testing being done. The total number of COVID-19 deaths that have been reported to us is 436, but as studies from New York City and elsewhere suggest, the true toll is greater, as deaths may not be classified as being caused by COVID-19, but would be in excess of what we had seen in previous years. So Fairfax County has more cases than any other Virginia jurisdiction and accounts for almost a quarter of the cases in the state. But this underestimates the true burden of the pandemic because many people with disease are not tested because they are asymptomatic, have mild symptoms, or just don't get tested. In the University of Virginia mathematical modeling, they estimate that only 15% of cases are confirmed. Thus, the true number in Fairfax may exceed 88,000, which is almost 8% of our population. Next slide. So the trajectory of the outbreak, defined by the number of new cases per day, is shown here. The most recent 2 weeks is shaded gray on the right side of the figure because the data are not complete for this period, which suggests that the decline in cases is greater than it truly is. But what you can see is that we have experienced a substantial decline since the peak of infections occurred in early May. Next figure. The dashboard also includes a page showing the racial and ethnic distribution of cases, which identifies a disproportionate burden of COVID-19 among the county's Hispanic population. The pie chart on the left shows the racial and ethnic distribution of the county's population, and the chart on the right shows the proportion of COVID-19 cases in each group. While Hispanics make up 16.8% of our population, shown here, they account for 65.3% of cases, and that's the updated number as of today. Another way to communicate this disproportionality is that disease among Hispanics is over 11 times that among non-Hispanic whites. By contrast, among African Americans, the rate is only 2.3 times that in whites, and the disease in Hispanics almost 5 times higher than in African Americans. One caveat with these data is that race and ethnicity are missing in about 20% of reports. The increased risk among our Hispanic population is not related to differences in biology, but rather to the social determinants of health, including the need to continue going to work, having jobs where telework is not possible and social distancing is difficult, taking shared rides or public transportation to work, lack of sick leave, for many, the unavailability of unemployment insurance, as well as crowded households, leading to greater difficulty to effectively isolate at home. Next slide. The differences by race and ethnicity also are apparent from these epi-curves shown by race and ethnicity. You can see the much greater success in flattening the curve for African American, Asian, and white populations, while COVID-19 cases among Hispanics tend to be higher, and the increase continued for a longer period than for the other groups. As we think about the communities at increased risk, so far I've described this in terms of ethnicity with increased disease in the Hispanic population, but it's important that risk groups also can be defined more specifically by their geographic area, such as perhaps a cluster of cases in an apartment complex, or by individual socioeconomic factors. So again, I would emphasize that the risk is not being Hispanic, but it's the exposures and the activities that occur among people in specific communities. Next slide. COVID-19 in children is more characterized by what we don't know than what we do know. In preparing this presentation, I looked for data in the medical literature, both published and unpublished, on COVID-19 in children, and there is virtually nothing available. The fact that we don't know the rate of infection in children is likely related to children being more likely to be asymptomatically infected, so they are not tested. But even when seroprevalence studies are done, in other words, looking for antibodies that are an indication of previous coronavirus infection, those studies have not specifically commented on the rate of positive antibodies among children. Last week, we worked with HealthWorks to do testing for the community at a site in Herndon, and we found no significant difference in test positive rate between children and adults. And the numbers are very small, so this is anecdotal and really can't be extrapolated to our entire county. But for persons who are less than or equal to 18 years old, there were 6 of 39, or 15%, who were positive. And none of these 6 children who were positive reported having any symptoms. There also are some international data that were reviewed and summarized, which suggests that in household clusters that are investigated, rarely was the index case a child, and some data when a child when a child is a contact of a case, Some data suggest that they are less likely to be infected than an adult contact. And these data are very different from what we see with influenza, where children are frequently the ones to introduce infection into a household. We also have seen the emergence of a new syndrome in children following coronavirus infection that has been termed the multi-system inflammatory syndrome of children, or MIS-C. This syndrome occurs in children who present with fever, prolonged fever, laboratory evidence of inflammation, and severe illness requiring with the involvement of more than 2 organ systems, including cardiac, renal, respiratory, hematologic, GI, dermatologic, or neurological systems. This appears to be a post-infectious complication that is related to the immune response, and we have had several cases of this syndrome that have been identified in Fairfax County. While it does not appear to be common, we are still learning more. Finally, I point out that the pandemic has impacts on children broadly that go beyond just those who are infected. There may be consequences associated with an increase in domestic violence or other responses to stress in the household, and you all are certainly more aware of the educational consequences than I would be. Next slide. So I'd like to conclude with a brief summary of the health department roles and engagement with the school system. And we've appreciated the regular conference calls that we've had with FCPS and the planning that has been done collaboratively with your team. As I've done today, we share the epidemiology of COVID-19 in Fairfax County with FCPS, and also we share these data with VDH, where they inform decisions that are made at the state level. We work with FCPS to conduct case investigations and contact tracing. And in the future, our case interviewers will ask every person who tests positive whether they're linked with a school, which will allow us to track cases, to identify whether multiple cases have occurred in a classroom or school, and then recommendations for isolation and quarantine will be made consistent with the Virginia Department of Health guidance. If an outbreak is identified, it will be investigated and appropriate guidance will be provided to the school. We've already discussed some scenarios with FCPS and will continue to work with colleagues from the schools and from VDH to define thresholds and actions. And these actions may include classroom-wide quarantine or school closure, depending on the number and location of cases. But again, that is work still to be done. And both defining the situations as well as the response to those situations. We have certainly appreciated the collaborations with FCPS, and look forward to continuing those discussions over the summer and throughout the year. Thank you.
All right, thank you so much, Dr. Schwartz and Dr. Gloria. We really appreciate all of this information. It's a great background for the rest of the conversation that we're going to have. And I know that board members will have questions for you as well. So we appreciate you being here with us. And again, we really appreciate all of your ongoing partnership and collaboration over these last several months as we've been working on our reopening plans. So as we transition now with the local health data as kind of background, what we'd like to share are the plans that we've developed based on the CDC guidelines for ensuring safe and healthy learning and working environments. So on this slide, what you see is the CDC guidelines that really is developed kind of as a decision-making tree. And it's put together in this format to help school divisions with developing their reopening plans. And in FCPS, we use this decision-making tool to develop our local criteria and our local guidelines for reopening schools that we'd like to share with you this afternoon. And here you really see the first questions that the CDC recommends that you need to address before moving forward with reopening. And the first question is, as we've just discussed with Dr. Schwartz and Dr. Gloria, are your reopening plans consistent with your applicable state and local guidance? So again, it's just really important that we emphasize to everybody that all final decisions about when and how we reopen our schools, as well as decisions about future closures, are going to be informed by the most recent local health data in partnership with the Fairfax County Department of Health. The second question that the CDC raises is ensuring that you're ready to protect children and employees who might be at high risk. So our reopening plans are built on the idea that we would be providing full-time online learning as an option to any students who are at high risk of severe illness based on the CDC criteria. And there's links in here to the CDC criteria for high risk, but it includes a lot of different categories like issues with lung disease, asthma, immunosuppression issues. So there's a lot of criteria in here that the CDC uses to define what being at high risk of severe illness from COVID exposure would look like. So for our students, we want to make sure that those students who are at high risk would have a full-time online learning option. And for our staff, we want to make sure that we have flexible leave and telework policies established and in place. Thirdly, the CDC recommends that we screen students and employees upon arrival. So we're working to develop a daily health screening form that would require parents to report that their children are asymptomatic and have not been exposed to anyone with COVID-19 symptoms prior to sending them to school each day. And we would have school-based staff, including school health aides, as available to help with screening of students who report those symptoms upon arrival, but do not have a parent health form completed. And we would require staff as well to self-report being asymptomatic and without exposure prior to entering the buildings each day. So that's the first phase of the decision-making tree. The second phase that we need to address is making sure that the CDC recommended health and safety actions are in place. And the first is ensuring that we have healthy hygiene practices. So we've developed guidance, proposed guidance in FCPS around hand washing, when hands need to be washed, how frequently they need to be washed, for example, upon entering classrooms, making sure that we're developing schedules where we can provide breaks for students to wash their hands, and also ensuring in situations where we might not have soap and water readily available, that we have hand sanitizer that would be provided for students and staff members as well. Additionally, the CDC recommends cloth face coverings be worn by staff and students where developmentally appropriate when those social distancing guidelines can't be maintained. And we would seek to provide masks to students who were unable to provide their own. Additionally, there's guidelines around intensified cleaning and disinfection. So we're proposing daily sanitizing of high-touch areas like doorknobs and handles and fixtures with medical grade sanitizing solution. More frequent monitoring and cleaning of restrooms, and then we have the ability to contract for cleaning services for deep cleaning and disinfection whenever it might be necessary. Additionally, we need to make sure that we have social distancing or physical distancing protocols in place. So that basically just means increased spacing of small groups and limiting mixing among groups. So we've developed guidelines to ensure that we could create separation on school buses, limiting visitors into our buildings, developing designated entrances by grade level, designating one-way traffic patterns through school, ensuring that students and staff groupings are as static as possible, certainly posting signs to remind individuals of the social distancing guidelines, and then trying to ensure that our desks are 6 feet apart and face the same direction, and whenever possible, having students eat meals in the classroom. And then the third component of the CDC decision-making tree is the need to ensure that we have effective monitoring systems in place. So again, just as Dr. Gloria and Dr. Schwartz said, we would be collaborating with the county to really monitor that county health department data, those cases, exposures, hospitalization rates, and other relevant metrics that might require a change to operating status. And if we did have an outbreak in a school or an office, we would collaborate with the county health department authorities, implementing all of those necessary health and safety protocols that were described that might require a change to our school operating status. So we believe that we've addressed the initial thinking behind the different phases of the CDC decision-making tree, and we've done that to establish those local guidelines here. So that really then brings us to what our proposals for reopening schools would look like. And I'd like to start by sharing the proposals that we've developed for 3 different operating scenarios for next school year that you see here. And I would note up front that these aren't really different options that would require us to choose between one or another of these scenarios for next school year. Rather, these are really different operating scenarios that we believe that we must be prepared to implement at different times throughout next school year. So the first scenario is virtual learning for all of our students. And we need to be prepared for this scenario in the event that we would have a resurgence of the coronavirus that might require us to close either a school or schools. In this scenario, students, of course, would not be allowed in our school buildings, and all instruction would be delivered through enhanced distance learning. And we'll explain that in more detail in terms of what that would look like. The second scenario is in-school learning with health and social distancing. And really our goal is to have as many students receiving in-school instruction as allowable under state guidelines and as approved by our county health department. So the state guidelines, however, may necessitate that we have a reduced in-school capacity in phase 2 and phase 3, of course. So it might mean that, for example, only 50% of our students, or maybe even only 25% of our students, might be able to attend school on any one particular day. This is also going to require those new health and safety protocols that we just discussed. And it may involve new instructional bell schedules to allow us to serve students on alternating days. And it might even involve prioritizing instruction for high needs populations like special education students, English learners, or our primary pre-K through grade 2 students. And then finally, is scenario 3, which would be online learning for individual medical need. And again, this would be full-time enrollment that would be offered to students as an option that are at high risk of severe illness from COVID-19 exposure as based on those CDC criteria. It could occur in either one of these scenarios or even under a routine operating status. And it would require additional instructional delivery for those students in different online models. And it may involve ongoing monitoring and intervention supports for those students. So that's a very high level overview of the 3 different scenarios. And what we would like to do next, before we look at the individual scenarios, is to just provide some information on some of the elements that would be present in any of these scenarios. So to start out with, technology and connectivity is going to be critical. For any of these operating scenarios, we want to ensure that we have one-to-one technology, meaning every one of our students has a personal electronic learning device and also has high-speed connectivity to be able to participate fully in online or distance learning. So we have ordered, of course, new computers for our middle school students. We already have devices for our high school students, and we recently ordered an additional 22,000 laptops to ensure that we can deploy devices to elementary students who need them. We're also working really hard to ensure that we have either home internet access with additional MiFis as provided by FCPS, or we're also working with internet service providers to try to develop additional free and low-cost internet partnerships. In all of the scenarios also, we're working on enhanced assessment practices to ensure that we have the ability to identify individual student learning needs at the beginning of the school year. And we're streamlining our curriculum to make sure that we're focused on the most important content standards from both the 4th quarter of this school year and next school year. And we're developing units and lessons and assessments that will support student learning and support teacher planning so that teachers can spend less time planning and more time focused on individual support for students that need it. Additionally, we're working, it's in the budget that we'll look at in a little bit, we're working to purchase new materials that will provide digital self-paced or self-directed learning opportunities to our students in math in grades kindergarten through grade 8, and in literacy in kindergarten through grade 6. And we believe that these materials will provide us with a lot more opportunity for self-directed learning and will ease that parental role and responsibility that many of our parents had to assume during distance learning this quarter. And we're also working to develop new resources and supports for social emotional learning with new screening tools and new curriculum and lessons as well. And then more importantly is really the work that we have to do to put an equity lens on our reopening plans. And as I mentioned really at the outset of the presentation, we know that COVID-19 and school closures have really had a disproportionate impact on some of our most vulnerable communities. So really now our challenge is to ensure that we're doing everything possible to mitigate those inequities. And that really starts first with our special education students. We know that they need increased time for synchronous instruction. Those expectations need to be consistent across all of our schools. We need more professional development for staff, and we need more training for our parents. And we have to ensure that students really are included in the least restrictive learning environments as required by their IEPs. We need to continue to provide instructional materials for our students to use at home that range basically from school supplies all the way to the necessary assistive technology that they need to participate fully in distance learning. And then whenever necessary, we need to make sure that we're able to convene virtual meetings for special education purposes so that there's not delays in services that students are entitled to. And then secondly, for our English language learners, many of whom are Hispanic, and reflecting on the health data that Dr. Schwartz just shared about the disproportionate impact on our Hispanic community, we need to make sure that academically we're doing everything possible to support our students. So we need to ensure high quality, designated minimum amount of time for English language development for our students. We need to make sure that we're developing additional assessments to identify student learning needs and targeting instruction to those needs. And more importantly, we need to really increase the amount of family outreach and support and education with our families so that our families understand all of the resources that we have, not just in FCPS, but in the county to support them and supporting their students. And wherever possible, we want to ensure that we have bilingual counseling, social work, and psychology services available to our English learner families. And then finally are the intervention services. We continue to hear a lot about the amount of learning loss that we might expect with our students when they come back to us in the fall. We've been working very hard to minimize that this spring by working to identify students who might be at risk even before distance learning began, contacting those students whenever possible through their base school and providing whatever supports that we had the ability to provide. And we're wrapping up the school year by identifying students that we believe need additional supports in the summer and in the fall to be successful. So we'll be able to start on the first day of the new school year with providing those intervention supports and resources to students as soon as the new school year starts. So we've done a lot of that work with really looking at systematic data collection. We're going to continue to monitor students' progress, and we're investing, as you'll see in the budget, a significant amount of funds to support those intervention services at individual base schools. So all of our base schools would get additional funds to hire additional hourly staff to provide in-school and out-of-school additional academic supports. And all of this work is going to be framed around our multi-tiered systems of support. So we're going to continue to enhance our professional development and coaching for all of our schools in multi-tiered systems of support. So with that background in mind, I want to go through the 3 different scenarios in a little bit more detail. The first scenario that we're looking at here would be virtual learning for all students. And of course, in this scenario, students would be learning at home. They would not be in the building. Staff would have access to the building for instructional purposes, but students would be at home. The instructional schedule that we're proposing would have 4 days of synchronous learning per week and 1 day of asynchronous learning for students to provide that necessary teacher planning time. And you can see what that would look like in terms of the different grade levels and the amount of synchronous instruction and asynchronous instruction on the slide here. I won't read through all of that for you, but I do want to highlight just a couple things. If you compare the amount of synchronous instructional time in this proposed model to what we're currently doing during distance learning this school year, it's essentially double the amount of synchronous learning time and support from what students are receiving currently. So another way that you could look at that would be to look at a sample schedule that we've represented here. So again, you could see those 4 days a week. Students would be within that virtual synchronous learning model, Monday through Thursday, and again, a sample schedule from the different grade levels here at elementary. And then on Fridays, that time for asynchronous work, that could be independent or it could be collaborative work virtually that students would work on. And again, giving teachers that really necessary dedicated planning time because it does take a lot longer to plan for virtual instruction. At the secondary level, our middle school and our high schools, again, you would see that students would have 4 days of synchronous instruction compared to the 2 days that they have this current spring. And one thing that I would point out here is that you'll notice in the elementary, middle, and high models that we are trying to have the teacher collaboration day, asynchronous day on Fridays. And the reason for that is we believe that if we had to use this model, that it would be helpful to families that might have students attending elementary and middle or high to be able to be home together on the same days, and that would support families with childcare issues. So that's a look at scenario 1. And scenario 2 then would be in-school learning, of course, with those health and social distancing guidelines in place. So here you just see a reminder of some of those health and safety guidelines we discussed, those health monitoring protocols, the use of a daily health screening form, social distancing guidelines of 6 foot of separation wherever possible, limited mixing among groups. That would include social distancing on our buses. And again, that ongoing collaboration with the county health department to really make sure that we're responding to any outbreaks appropriately, the increased sanitizing, and then of course, limiting building access in accordance with those health and safety guidelines that we discussed. So scenario 2 then specifically, we've got 2 different models that we're representing here. And one would be at a 50% model where we would run with only half of our students in school at any one time. And a second model, which is a 25% in-school capacity, where only 1/4 of our students would be in school at any one time. So if you look at the first model, the 50% model, there's basically 2 groups of students. So we would divide students in our classes into 2 groups. One group would attend 2 days a week on Monday and Wednesday, and then they would be learning online or asynchronously at home on Tuesday and Thursday. And then that would obviously flip for group number 2. On Friday, then, the thing that I really want to call your attention to is in the AM block, we would provide intervention services for students. So this again would be based on a student's IEP needs, their English language development needs, or particular math or literacy needs that have been identified. That morning block of time on Fridays would be reserved to working with small groups of students to provide that additional support. And then we would reserve Friday afternoons for teacher planning time. So that's very similar with the 25% model. Again, the only difference is that you would only have a quarter of your students in school at any one time. So of course, on a 50% model, students would see their teachers for each of their classes 2 days a week. And on a 25% model, they would only see their teachers 1 day a week. The other thing to note on this model is that we would propose at the middle and high school level using an 8-period day. And the reason for that is it would allow more frequent contact between students and teachers. If there's, if we were to maintain an every other day schedule, the amount of contact would be even less frequent than it would be on the model shown here. So we also wanted to show really just a schematic of what social distancing might look like in the classrooms with respect to classroom arrangement. So here you can see 2 different scenarios. One is on the left-hand side, our secondary, our middle and high school classrooms. And on the right is an elementary classroom. And you can see that the desks are arranged to have 6 feet of separation between the students, which obviously significantly limits the amount of students that could be in any one classroom at any one time. Similarly, we wanted to show you what it might look like for social distancing during transportation and busing. And again, the model on the left-hand side, you could see we would have 1 student per seat. The model on the right-hand side, you could see we would have 1 student every other seat. And even with one student per seat, we have really significantly reduced seating capacity. And that would take our bus capacity down to about 23 to 25 students per bus. And we would then cut that in half if we had to be with one student every other seat. And that, of course, would require additional buses and additional drivers. And that doesn't seem fiscally prudent to do. So we're really looking at a model of one student per seat with enhanced health and safety protocols. And that would mean that when students boarded the bus, they would be assigned a seat. They would be required to wear a face mask while on the bus. And we would provide additional personal protective equipment like face shields to our drivers. And we would have significantly enhanced cleaning procedures in our buses. And all of that, even with one student per seat and all of those health and safety protocols in place, still may require us to modify our bell schedules. Because of those additional runs and that additional time for cleaning of our buses, it would be possible that we might need to add another run, another bell schedule, if you will. And that's represented in the chart in the middle so that you can see the difference between our current bell schedules and what those proposed bell schedules would be. And the thing I would call your attention to most is the second elementary bell schedule on the proposed side, which would begin at 10:05 a.m. and end at 4:50 p.m. So again, these are tentative, but we wanted to provide you with what some of the real impacts to social distancing and transportation would look like. And one of those big impacts is on the reduction and adjustments to our bell schedules. So moving to scenario 3, which would be full-time online learning based on individual medical need. Again, at the elementary and high school level, we would try to make sure that we were creating those intact cohorts of students. So students would have dedicated teachers to work with them throughout the year. We would be providing enhanced curriculum, but we would be focusing really on the state requirements. So we wouldn't be able to offer everything that we currently offer in our program of studies, but really focusing on those state requirements. And then we provided some information here on what that might look like in terms of synchronous instruction and what a bell schedule might look like. And you can see we're proposing 4 days of synchronous learning for this model and 1 day of asynchronous learning for this model. Now, this would be very different than what we're doing now. So it would be really important to note that there would be some conditions and some requirements really both for the division and for families. From the division, we would need to make sure that we're able to provide this option to students that have that medical need as defined by the CDC. We would make sure that we're providing those full-time options and supports, allocating the appropriate teaching staff to be able to do so. And it would require some modifications to some of our delivery models for special ed, ESOL, and AAP services. And we would also try to make sure that we could develop a model for grab-and-go lunches. For families, a few really important things to note would be that we would really need to know as soon as possible families that would be interested in pursuing this option. So we've established a date here. It's a tentative date of July 10th. And the reason for that is it's going to take a significant amount of time to develop the additional schedules and assign the additional staff and help staff be prepared for the first day of school on August 25th to teach in this format. So we really will need to know as early as possible families that might be pursuing this option. Additionally, we would really ask our families to make a full year commitment to this model, as it would be very difficult to change our schedules during the school year. And, we would also really want our families to understand that we really couldn't guarantee that all of our programs and course offerings would be available. We certainly would make sure that students had all the required courses and were on track to meet graduation requirements. But some specialized courses and programs, we would not necessarily be able to offer all of those. So again, thinking about these 3 scenarios, we just wanted to point out that what you see here on this slide is, as we heard from our colleagues in the health department, COVID-19 really still is a very fluid situation. So at best, we're hoping that the worst is going to be behind us and that we'll be able to continue to ease social distancing restrictions and be able to bring students back to school as soon as possible. But at worst, We do need to make sure that we're prepared if we see a resurgence either in the fall or if we see ongoing waves or outbreaks in certain places in our community. We need to be prepared to be able to return to a distance learning environment very rapidly to ensure that there's not a disruption of educational services to our students. So just a few additional considerations that we wanted to make sure that everybody had as some additional background to think about as we're talking about our reopening scenarios. And the first is support for staff. So again, our goal would really be to ensure that all of the staff in FCPS have the resources and the supports to feel safe and comfortable returning to work. So our HR department is working really hard to update telework regulations and to make sure that staff members in the HR department are available to assist employees in really understanding all of the health and medical leave benefits that are available to them. And they stand prepared to work with any employees that have questions about those benefits. We're also working very hard to secure personal protective equipment and making sure that our folks have the materials and supplies, whether it's masks or gloves or gowns or face shields, depending on their individual assignments that they need to do their job safely. And we're making sure that we're providing staff with resources and support to address their own personal health and wellness needs. And then, of course, enhancing professional development in a number of areas, including support for our teachers in the use of virtual or blended learning strategies. And then finally, at the bottom, you see childcare. And we've heard from a number of staff members about the challenges of finding childcare, particularly for school-age children. So we don't have a solution to this, but we do want people to know that we are working on this. We hear you, we recognize this as a challenge, and we are exploring additional opportunities for school-age childcare in FCPS. Additionally, support for families. Our goal here is to ensure that our families have all of the resources and supports that they need to feel safe and comfortable sending their children back to school. So we certainly want to make sure that we're able to maintain the food services that our food service department has been working so hard to provide over the last several months to our community. Our language services are incredibly important in terms of providing, again, oral interpretation services and written translations of all of our documents so that all of our families understand the supports and resources that are available to them. We're also working hard to enhance training, parent training and resources to support parents in understanding all of the resources available to help them, supporting their students' academic success. And then we want to continue and expand the technology support that we can provide to parents and students with computer troubleshooting. We also know that a lot of our families have questions about what summer supports are going to be available to students. And we have discussed this in our May school board work session. And since then, we've developed a number of different virtual summer support programs that we just wanted to reference quickly. For all of our students, kindergarten through grade 12, we have what we're calling continuity of learning services. And here we're providing students with self-directed learning materials. Again, digital materials that I talked about earlier, as well as some written materials. So for example, in kindergarten through grade 8, we're going to be mailing summer practice books in language arts and mathematics. And those materials are really hopefully going to help students with additional preparation for a successful return in the fall. But we know that at times students might need help and have questions. So we've provided staffing to each of our elementary schools to provide teacher office hours on a limited basis, but those office hours will occur on a weekly basis. And all of that programming is free to our students. At the high school level specifically, we've expanded our credit recovery program and we've increased the capacity of the number of students that we can serve there, as well as allowing students that might not have failed a class, but did not do as well as their teacher believed that they needed to do to be adequately prepared for next year. So we're allowing those students to participate in our summer program. Again, that's a virtual model, and it is also free to students. We've also expanded our online campus, so we have more capacity to offer courses for new credit, including ESOL supports, and we've reduced our student tuition there. And we've set recently an all-time record of over 8,000 students who have signed up to participate in our self-directed economics and personal finance class, for example. So we're seeing a lot more interest in our online campus programs this summer. And then for special education, we've designed a virtual model, both for extended school year services, as well as preschool autism. And those programs really begin in late June and run through July. And all of those programs, we're communicating out those different options and opportunities to families currently, and we'll continue to publicize them. We've also had some questions about what's happening with athletics, and we are working on plans to resume athletics, but of course, we have to work very closely with the Virginia High School League to really determine what's permissible. And there are currently very tight restrictions in place. So for example, conditioning and agility is available to begin with strict social distancing on June 22nd. But prior to that happening, all of our coaches are going to have to complete a mandatory training session. And all of those conditioning and agility sessions, is important to note, are individual sessions. Those are not group sessions, not scrimmage activities, and they would only take place in outdoor facilities. And then also, just we know there's interest in the community that our county parks have been begun reopening fields for permitted users for club and travel sports, and that started on last Friday. So we're going to see scheduling of some of those activities, we believe, very soon. So as we begin to wrap up here, just a few other things that we wanted to highlight. One is our communication plan. We know that communication over the coming weeks and months is going to be incredibly important as we really finalize the details of our reopening plans. So our goal certainly is to make sure that we're including stakeholder input in all of our reopening plans. So to that end, as I mentioned, we have a family and staff survey that are currently out, and we're going to attempt to share some of those findings with the board on the June 23rd work session, and hopefully that will inform the board's school reopening discussion. And information in those surveys, we're going to be soliciting family opinions about the different scenarios that we discussed today. We're going to be providing information on staff comfort levels about returning to work and the supports that they need to feel successful, as well as collecting staff and family perceptions in more detail on the effectiveness of distance learning from the spring, so that we can use that information to really refine our reopening plans for the fall. And then finally, we're going to be working to make sure that our stakeholders are up to date with information about our reopening plans. We'll use a lot of our traditional strategies like direct communication, letters, emails, videos, website postings, social media postings, but we've also begun to hold town hall events. There's another town hall event that's going to occur later this week, and we're going to increase our collaboration with other stakeholder groups, community organizations, faith-based organizations, businesses, because we want to make sure that we can get the messages out to people in the communities in which they live and work. And then most importantly, perhaps, is guaranteeing translation services into all of our communication strategies. So Dr. Brabrand mentioned some timelines that are coming up. Again, these are draft timelines. And certainly we don't have all the details worked out yet, but time really is important. And there are key decisions that are going to need to be made soon if we can continue to work towards a smooth operating and opening for next school year. So the first date that you see is June 26th, and that's just a couple days after next week's work session. And the idea here is to be able to communicate our decisions to the public no later than June 26th about our reopening status for next year. And we need also, as I mentioned, to communicate the registration deadline for families that would be opting based on medical need for the full-time online learning option for next year, so that we can begin to establish that program. So the deadline, again, that we've established for that currently is July 10th. Then by August 10th, if we're operating under a social distancing schedule that would require us to have a reduced percentage of students in school at any one time, we really need to be able by August 10th to tell the families which days of the week their children would be attending school. And the reason for that is if families need to find childcare, that only gives them 2 weeks prior to the opening of school on August 25th to finalize childcare arrangements. And then the week of August 17th through the 21st, We would want to ensure that families have information at the middle and high school level about their schedules, and then also making sure that we've established technology distribution plans and communicated all of that information to the community. So finally, here we've prepared essentially the 3 different scenarios that we've discussed with some benefits and risks. And we think that this just might be helpful in thinking about how to compare some of these different models. But again, we believe that we need to be prepared to offer these different models. Scenario 1, of course, again, virtual learning for all. There actually is, on the benefits side, some consistency for students and teachers. And there's 4 days a week of contact time that students would have with their teachers under this model. Of course, the risk side is that in a virtual environment, some of our students may become more disengaged, and we may see widening of achievement gaps, for example. In scenario 2, where we would be bringing students back with social distancing guidelines in place under a reduced percentage of students, the benefit, of course, is that students would have more opportunity for that face-to-face, in-person connection with teachers and peers, but significant amounts of asynchronous time would exist in this model. So for example, even on a 50% model with social distancing, students would still be learning asynchronously or at home 3 days, well, not at home, but they would still be learning asynchronously 3 days, up to 3 days a week. Childcare also is a challenge and a risk with this model. And it's also going to be difficult to maintain social distancing in our schools. And then scenario 3, full-time online enrollment for those individuals with medical need. It certainly is a benefit that it would meet the needs of students that would have a severe risk of illness. But again, there would be, on the risk side, some limitations to program offerings and limited social interactions. So as we close out the presentation, we want to provide some information on the budget. And I'd like to invite Ms. Burton to discuss some of the financial needs that are associated with the reopening scenarios that we've discussed so far.
Good afternoon. If you look at this chart, it basically shows 4 columns. The first column is the item or description of what we're planning on funding at this point. The second column is the 9.3 recurring post-COVID-19 placeholder that is in the fiscal 21 budget. The next column, or third one, is the one-time CARES grant of $19.2 million. The total original request is the 4th column, and then the unmet need is the final column. So the first item is personal protective equipment, cloth masks, and other PPE like face shields, gowns, and gloves. Those are being funded at $5.2 million under the CARES grant. And just so you can understand how this little spreadsheet works, the total original request for PPE was $5.9 million. We had assumed a greater number of cloth masks, but due to funding levels, we pulled that down by about $700,000 so that the final amount ends up being the $5.2 million. And you'll see the same thing in many of the items, in that the original request is a higher amount, but we've scaled back what staff and leadership believed was needed to fall in line with the recurring placeholder of 9.3 and the CARES grant of 19.2 million. Facilities cleaning, the second line item is at 2.3 million, and that is for 3 months custodial staff overtime and additional cleaning products for buildings and buses, again at 2.3 million. Thermometers, we're assuming handheld thermometers at 1 per 500 students as far as allocation to the schools, plus central offices, that's about 200,000. Health service staffing, that's 5 nurses at a cost of 600,000. Technology connectivity, we think we'll need another couple of thousand of MiFis. The actual devices cost $100 each, but the connectivity piece is an ongoing cost of $300 annually. So you can see that those items are split up between recurring and one-time funds for a total of 0.8. a full-time SPITS at every elementary school. That will add 13.5 SPITS to the elementaries at 1.6 million. A full-time T-SPEC at greater than 750 enrollment. At 1.9 million, we have only funded 16.5 out of this recurring COVID fund that we have in the fiscal 21 budget. But recall that there's also a $2 million placeholder, and so we've opted to fund 8 of the T-SPECs out of the that technology infrastructure and support placeholder at about $1 million. And again, that decision was made because we do not have enough funds within the recurring placeholder and the CARES grant to be able to fund everything that we need to do. Curriculum resources, digital resources for K-8 for language arts and math is 2.6 million, and that is for student self-paced digital resources to support intervention. Curriculum resources for social emotional, that at 1.1 million, that is a screener to assess social emotional learning competencies and curriculum development for social emotional learning. Intervention support staffing is hourly funds to provide to schools on a per pupil basis at $13 per general ed student and $26 per free and reduced lunch student and EL student. And that's just a formula to allocate funds that schools could use for hourly teacher staffing. The next item is additional counselors. 10 counselors at $1 million and 10 psychologists at 1.1 for a total of 2.1. The special education, remediation, and recovery with the focus on the fall of 2020 is 2.9 million, and that is for tutoring, related service therapies like OT, PT, speech, those sorts of things. That's at 2.9 million. Student registration and scheduling. Of course, with these scenarios, especially the hybrid or staggered one, there'll be master schedule revisions, class adjustments, class balancing, tracking attendance, those sorts of things that will need to be addressed, and that is costed at 2.3 million. And then the last thing on the list is elementary school laptops. You know, we would like to do an outright purchase for those 22,000 laptops. But we just don't have enough flexibility within the CARES grant and the recurring post-COVID funds to be able to do that. So you don't see those identified here in the first 2 columns with numbers. Instead, we'd like to fund those with lease funds, which would make the first payment in fiscal 22 at 2.8 million each year for 4 years. And there's a note at the bottom of this chart that indicates that. So the total for all of these items under recurring is 9.3 million, which is what is budgeted. For the one-time CARES grant, it's 19.2, again, aligning with the funding level. The total original requests that various staff members and leadership and the workforce has put together total 54.9 million. Leaving 26.4 million that is needs that are unmet, again, due to funding levels.
All right, thank you very much, Ms. Burden. So we are just wrapping up now, and we just wanted to remind everybody of the guiding principles as we close this presentation that we've been working under. And I want to thank you for your attention. I know we went 30 minutes over, and I apologize for that, but there certainly was a lot of information to cover. So with that, I'm going to turn it back over to Ms. Sizemore-Heiser and Ms. Pekarsky to facilitate the board discussion.
Thank you, Dr. Presidio. Thank you for that very robust presentation. As you said, there is absolutely a lot to go over and to consider. Before we get started, however, I know there's lots of questions. I do want to welcome our new student representative, Nathan Onabundo. Thank you for joining us today, Nathan. I know you are as interested in this discussion as we are today. So with that, Ms. Rachna Sizemore-Heiser will kind of frame this discussion for us to stay organized and keep it moving. And I will be happy to time all our speakers. If we could stick to our 3 minutes a person, that would be very helpful, and we could do go backs. Rachna?
Thank you, Stella, and thank you, Ms. Pekarsky. And just very briefly before we get started, I just want to reminder to everybody watching and our school board that we will have 2 work sessions on our return to school before we get consensus for our school system by June 26th. So there's plenty of time to give input and gather more data from our staff, and there's time for input from our community as well. And I just wanted to sort of frame again that the goal for this work session is to talk hopefully in some sort of the bigger picture logistics around health and safety, scenarios, curriculum, resources, staffing, and really hopefully we'll gather more data this next week and information and go really deep into the details next week. So I just wanted to frame that out. Again, I'll be calling on you and taking some notes, and Stella will be timing us. So with that, I will go ahead and start. Our first one is Ms. Darnat Koufax. So floor is yours.
Thank you so much. I do want to thank Dr. Presidio and Dr. Brabrand and your team for all of your hard work, and the task force for bringing these plans and these options to us. As Ms. Sizemore-Heismer said to us, I would like to talk in a bigger picture and then go down to a more granular level. And I have comments first and then some questions. So I really want to say to the public out there, we know that whatever decision we make, it will be a compromise model to educate our children, but know that we are doing this to keep your students, our students, your children safe and healthy. There is a lot of information out there, and if you only take it in piece parts, it's not the entire package. For example, Governor Northam had stated, to be clear, schools will be open for students next year. And when you hear that by itself on its own, it's a very different meaning that when you read through the guidance that states schools have the flexibility to be more limited in their in-person instruction as determined by the local health department, and in our case, by the size of our student body. I've heard from teachers and families that are not comfortable returning. I've also heard from those that think everyone needs to be back full time. And I'm hearing all these opinions and I'm listening. But I want you to know that mostly I'm listening to the health officials that are stating we can save lives by changing our behavior. So I think that's very important. So I'll start with my questions quickly. The governor's reopening plans did talk, as I just noted, that schools have flexibility to be more limited in their in-person instruction. And the county, we talk about, and based upon that determination of our health data. So my questions will first go to Dr. Gloria and Dr. Schwartz, and thank you both for being here and being part of the task force today. And Dr. Gloria, I talked about this with you on the task force last week, but I just want greater clarity. Perhaps I misunderstood when I asked if we have been monitoring cases in our schools specifically, and I believe you said no, not at this time. If we're not doing that, when will we begin, number one, particularly if scenario 2 is the is what we adopt, and are we considering at any type of mass testing of students before they come back to our schools? So that's my first question, and if you could stop the clock, Ms. Pekarsky.
I did.
Sorry. So, so currently school is out. And as Ben mentioned, as we do contact investigations, we do find, when we are talking to cases, we do find out, what they do, where they may have had exposures and so on. And so if there is a case that is a Fairfax County Public Schools employee or a student, that information will come to light. It's not, I guess my response to your question is that we are not actively surveilling FCPS students because the students are not in session. You do know that during when school is in session, we have a syndromic surveillance system based on absenteeism that enables the school health staff to look into absenteeism to figure out what might be the cause of it. using influenza-like illness symptoms and so on. That work happens when school is in session and is not currently being done because the kids are not at school. Could you please say the other question again, your second half of that question?
My second half of the question was, would we consider any type of pre-testing before the kids come to school, like any type of mass testing? Like, you know, I've been reading about the NFL and the collegiate athletes now, and they're pre-testing them before they come back to practice. I mean, I know athletic different, but you know, would that be a considered option? Some type of testing before entering the classroom by the county?
No, there is no plan at this point to test FCPS students prior to them coming to school. I believe the presentation talked about screening forms that FCPS was putting in place. That is the CDC recommendation, that through the use of those screening forms, that students are identified who may be symptomatic and therefore excluded from school for that day.
Okay, thank you. And I do have, that's segueing into my next questions, Dr. Brabrand and your team. I guess how, with the screening, these reporting forms, how will they be submitted? Who will monitor that the families are completing? Will students be allowed in school if the forms are not complete? Will they be allowed on the bus if they're not complete?
And
Thank you,
I
Mr.
can-
Fairfax. That's a great question. And the bottom line is the details around the screening forms are something we don't have for you today. We certainly will get that to you as soon as possible. We were hoping the state would release a potential form, and we haven't seen that yet. And we're hoping that they do. If not, we do have a health screening questionnaire that we've been using when we did laptop distribution. And that we could use that form, but the logistics of whether it's going to be paper, whether it would be lanyards on a kid, whether it would be a mobile application, like, you know, when you go through a drive-through and you scan your phone, we just don't have that level of detail yet, but we know it's something that you're asking, the community is asking, and we've got to figure out the logistics, because you're talking hundreds and hundreds of kids coming in at once. And how are we going to do that? One of the things you heard Dr. Presidio say, we are talking about kids going through separate entrances, right? Both coming in and out during the day, so that we're not having them all funneled through one entrance, but the specific logistics are still to be worked out.
Right. Thank you.
Okay.
That was great, Ms. Janakopak.
My time up.
Yeah, would you like to go back?
We're trying to go back.
We gotta go back. All right, next I have Ms. Corbett Sanders.
Great, thank you. And thank you for this very extensive presentation. It is greatly appreciated, all of the work that the staff has put in to get us to this place. I do have a number of questions and I will probably need to go back immediately. So there are a couple things. Absent from this presentation is a thorough discussion about our DACE programs and what we're doing for our most vulnerable students with disabilities. And so I would love for someone to address that. Additionally, you have two options for an in-person learning. One is at 25% and one is at 50%. But that will really be driven, the effectiveness of 25% or 50% is driven by the capacity of an individual building and the current enrollment at that building. And what does impact the enrollment at buildings is the pupil placement of students into those buildings. So is there a concept that during this period of time we would limit pupil placement so that we actually have the buildings being utilized for their existing student body? And what are we doing to really even out our enrollment so that we don't, even with a 25% of enrollment, if a school's at 118% in capacity, then 25% of that still is higher than another building. So looking at that capacity loading piece. Additionally, for PPE, have we looked at including face shields because rather than just masks? Because for many of our students, they need to see the teacher speaking so that they can absorb what is being said. I would also like to talk a little bit about the ESY program for this summer because that is something that the state superintendent has raised as being important to have in-person supports for our students with disabilities. And then I would also like to better understand why the scenario 3 which has virtual learning for students that have medical needs. There's 2 pieces of that. Why can't we just establish a pure virtual play for all those that want it and have that be a standalone high school or standalone K through 12, which then would meet the needs as described in the first option of virtual. So you would actually allow parents to opt into a pure virtual or a in-person by July 10th. And then you could do your master scheduling from there. Additionally, one last piece before people have a chance, and adding to that is utilizing the Northern Virginia Community College dual enrollment opportunities to expand that as well as virtual Virginia. And then last on the budget piece, it's a 20.
I don't mean to interrupt you.
Am I done? Can I just finish this real quick?
You're done. Please finish your last question and then we'll put you on the go now.
26.4 million shortfall, but if it looks like it's actually 16.10 million, if we take out the 10 million for the devices, because those are being put into a lease system with 2.8 starting a year from now. So I'd like to better understand, is that 6.10 available in our year-end budgeting, or are we having to go find 16.10 million, or is it what we have to find is 26.4 million? So that's a lot, and that didn't cover my questions, but that's a start.
Okay, well, let me take a crack at it, and then I'll let Ms. Johnson and Dr. Presidio and Mr. Smith, Mr. Planenberg. But let me take a quick run through. We're certainly looking at day programs and looking at the special needs for those kids. We're still working very much with our staff around how we would support those kids face-to-face, and we're looking at potential transition programs in August. We really have worked hard months ago to stand up our virtual approach for ESY for the summer. And we still believe, given the health conditions that we have, that virtual is the right play for the summer. And we would focus on the fall or potentially some transition programs like a bridge to kindergarten, a bridge for some of our special needs kids. Pupil placement, we have not looked at yet. We can look at that. PPE does include face shields. We are looking at face shields in particular for bus drivers, face shields for bus drivers, and face shields for some of our special education teachers who are with kids that may have needs where they're coming in very close contact below the 6 feet social distancing, to have shields as opposed to masks for them. ESY, as I talked about, our approach is virtual, but looking at potentially some transition programs for August. One of the reasons scenario 3 is focused on medical need is the state priority is to serve those first. And one of the things we have to be careful at that we learned in the spring with distance learning is that do we have the capacity to stand up this virtual option with the level of demand? And we need to be sure we can meet the demand for those with the medical needs before we would open it to everyone. Dual enrollment, I'll let Sloan speak to, and I'll let Lee speak to budget. And then Teresa, anything I missed, please, or Jeff, Marty, that I missed, add in. Sloan, Lee?
Yeah, thank you, Dr. Brabrand. I mean, I think the short answer on dual enrollment is we continue to collaborate with Northern Virginia Community College and look at all options. So they have brought forth some interesting proposals and ideas about expanding access to dual enrollment through a virtual format that we're exploring with them. We had a meeting with them about a week and a half ago. So we're still continuing to work on that. And we do hope that we're going to have some additional enhanced opportunities that we haven't had available in the past.
Lee, do you want to talk budget, and then if Jeff can talk capacity loading?
Sure. Yeah, the reason the 10.3 lease purchase is listed on here is because if I didn't list it, then there would be no discussion about it. The motion that the board passed back when we wanted to get these computers in the purchasing queue did not include language about how they would be funded. And the finance chair had hoped at that time that we would be able to do an outright purchase out of the CARES funding. But then once you look at all of these needs, it's pretty obvious that we do need to lease those computers, as we do with all computers. That's pretty standard routine procedure. But I guess there still needs to be a conversation or consensus that leasing is the right way to go. And once that happens, then that will come off of this list.
Lee, I'm sorry, that wasn't the question, but I appreciate that answer. The question was, is the shortfall when you have your unmet need, if you take the 26.4, you subtract 10.3, you end up with 16.1. Is that what the unmet need is actually, rather than the 26.4?
Yes, assuming consensus to lease the computers.
Okay, so at 16.10, then is that, do we have it in our year end?
No, we do not have it in our year end. We have very, very limited funds that are going to be available at year end. You know, staff has scrubbed, you know, all of these items as much as they can to be able to meet the needs of students. And so the scaled back version that is within the funding for the 9.3 recurring and the 19.2 CARES grant is certainly adequate. But we felt that it was important that the board and others know that, you know, if we had additional funds, then we would increase the level of support that we could provide.
Thank you. And I think, Mr. Plattenberg, there's some questions around facilities that Ms. Corbett-Sanders had as well.
Yeah, I'm sorry. Could you repeat the question?
It's capacity planning and loading, Mr. Plattenberg. And so if you have a 25% virtual play or a 50% virtual play, it doesn't look the same at each individual school, because if you have an overcrowded school, right, then you have 25% of overcrowded makes that school actually closer to 35 or 40%. And 50% of overcrowded could be as high as 60%. So have you done any sort of looking at our capacity to see what happens to those schools and whether you can actually do the social distancing at an overcrowded school at 50% versus 25? Okay.
Yeah, thank you so much for repeating your questions. I apologize for that. But in our proposal and the sample schedule that we provided, when we took a look at that, we did take a look at from a 5,000-foot view. We do know that then, whatever way we move forward, we will definitely have to have that conversation with the individual principals taking a look at it, because not only do you mention that, but when we look at the number of program offerings we have at the various sites that we have, it will create some challenges. But that's why at 50% or 25%, we felt that we could accommodate based upon the square footage in each of those facilities. We did take a look at it from that global sense, but it definitely would require us to get in a more granular level.
So as a next step, if we could just, at all of our overcrowded schools, do an assessment prior to next week, because that will require us to make an informed decision as to whether or not they can accommodate the social distancing and that level of students.
Yeah, just for clarification, for the next step next week, in the 4 weeks that we've had to get this prepared, with all the action teams and so forth, I don't know that we'd be able to get every principal to do an analysis on the program offerings that we have, but we'll take a look at what your ask is and see to the best extent possible we can go ahead and provide a response.
Thank you. And I think Ms. Corbett-Sanders also brought up pupil placement. That may be something to look at in that analysis as well. And there was just 2 other questions I don't believe got answered. With face shields, I believe Ms. Corbett-Sanders asked about being students being able to see their teacher's face and mouth, not just for safety. And then master scheduling after the opt-in to the virtual learning. I just wanted to make sure those pieces were covered.
Well, it was whether we could do a pure, just a standalone virtual learning, so that if parents said, I want the experience pure virtual, and it doesn't depend on a medical need. So our hybrid would be both.
So let me go back on the face shields, or seeing the teacher's mouth. Is that what you asked?
Yeah, as opposed to just purely based on safety.
The state is saying that if you're not within 6 feet, the teacher may remove the mask as long as they're farther away than 6 feet. So if a teacher's up in front of the classroom lecturing, they may drop the mask down and leave it down until they're within a 6 feet zone of the student. That's what the direction we've gotten from the state. And on the virtual, again, the simplest way I can say it is we need to look at what the demand is to deal with our kids with severe medical needs before we can make an offering to be able to stand up all the technology infrastructure for a fully virtual option. And I will be honest, we did look at it from both ways, but we're very concerned about over-promising and under-delivering. We did that before, and we don't want to do that again when we're offering a virtual option for this group of kids.
Great. Thank you very much, Dr. Braybrand. Next, I have Dr. Anderson. Ms. Cohen, I saw your hand up before hers and then went down. So I'm going to go with Dr. Anderson first, unless you really want to go ahead.
Nope, please let Dr. Anderson go ahead.
Okay, Dr. Anderson.
All right. Thank you so much. I do want to say thank you to the staff for all of this information. I know it hasn't been easy, but I've got to jump into my questions because time is limited. I want to have my first set of questions regarding some of my the health questions that I have. We talked about during the presentation, I believe that Dr. Schwartz, regarding the extensive testing and contact tracing, you mentioned that there has been an increase. If you could share a little bit of a benchmark, what did we start off with and where are we now? Just so I can get a better understanding of what that increase looks like.
So the contact tracing, the health department has always investigated every confirmed case of coronavirus. And so we're going to continue doing that. When we move to this next suppression stage, we'll have a greater ability to do thorough contact tracing. And so be able to identify those individuals individually and talk with them each about the need for quarantine. In terms of testing, the number of tests that are done every week has increased really rather remarkably. And so now in Fairfax County, we're doing between 8,000 and 10,000 tests per week, which is a significant week-by-week increase in the amount of testing that's available. In addition, it appears that there is some testing capacity that is still underutilized, and more sites have brought on that testing capability as well. So right now we seem to be in pretty good shape regarding the capacity to do tests.
Thank you for that. Also, this question is for you. I don't have a number on that slide, but it's the one where you talked about the racial and ethnic distribution. What considerations should be part of the thinking of FCPS as per the information that you presented on this slide? Is there anything that particularly we need to pay attention
to? That's a really good question. I guess I might try and answer to that and then ask Dr. Gloria to chime in as well. But what I would say is that as we follow the racial and ethnic distribution of who is getting infected, that information can help inform the school system about where there may be greater risk in the community. And we know not only by race and ethnicity, but also geographically where the cases are occurring. And so that may just increase our awareness of what schools and what areas of the county are more likely to be affected. I think it also will give us information about where families are more likely to be affected, because often the case that occurs in a household is going to occur in an adult household member, not in the child. But because there is household exposure, the child will then have to be quarantined and stay at home. So you're much more likely to see that situation accruing for the Hispanic population, where there's a higher rate of disease in the community.
Thank you for that. But I think I was looking for, if this is not the right opportunity, that's fine. But I think I was looking for any specific implications that we needed to be paying attention to. I do know that there's close conversation between the health department and FCPS. And so I would love to hear if there's anything specific that we do need to do to mitigate some of those risks in various pockets of our district. I would like to hear from that at some point. Going into technology a little bit, one of the things that I want to be sure that no matter what option that we have here, whether it be virtual at some point or scenarios 1, 2, or 3, I think this is applicable. Streamlining the technology access, if we have more opportunity for students to engage in classes on a more regular basis, having 7 links for middle school and high school students can be quite a challenge. So I would love to hear how we can streamline that a little bit. Also, with technology for staff, I did not hear how we are ensuring that we can utilize staff who are at home for whatever the reason in order to be able to impact and to work with kids remotely. We do know some of our staff do not have access to technology, so I'd like to hear about that. And also with the leasing, going back to Ms. Burden's presentation on page 55, I guess I still have some level of confusion as to why we're not continuing to lease the devices in terms of purchasing them. So I'd like an answer to that as well. I'm happy to follow Karen because the face shields I think are essential, especially from an instructional point of view. If we could consider having face shields for teachers, because in a classroom, it's realistic that as teachers are walking through, it's easy to forget that your face mask is on or off. Just having that clear shield may be helpful. Please place me for a go back. Thank you.
Great, thank you, Ms. Anderson. I got you on the go back list. So next I have Ms. Cohen.
Did Dr. Anderson have
I didn't get any answers to my question.
Yeah. I'm sorry, I apologize. I thought it was the comment you're making. I apologize.
No. I have questions there. Technology and yeah. Thank you, Dr.
So Dr. Anderson, Mr. Smith, can you talk about the links? I believe the links have to stay as they are. If you have an update on that, Mr. Smith, and around the technology for staff, I believe we have ordered additional computers for staff. So, Mr. Smith.
Yeah, so certainly, yeah. We are working, currently we're working to continue our addendum so that we will be able to access Blackboard Collaborate in the same manner that we've done during distance learning during the pandemic. We are also working with Blackboard to see if there's the ability to lessen that impact on students and staff by taking another look at the possibility of using the Learn platform to access those courses, which again would take the load off of students and staff. But we would, of course, need full assurance that that would work and work well before we would take that step. But we are looking at that as an option. With regard to those staff members who would need additional technology to support students at home, we've set aside approximately 3,000 computers, when we look at our total inventory of computers, as we purchased the 22,000 laptops for our 6th graders and 5th graders at Title I schools, we also set aside approximately 3,000 laptops so that we could distribute those to instructional assistants who could then provide that access or that support for students in addition to classroom teachers. And we know we've talked about that access, MiFi access for students, and know that we will have to continue our efforts working with principals to identify those families who might need additional access for the internet. And we also know that we have a handful of staff members who do not have access to the internet. And so, as Dr. Presidio shared, we're working with our internet service providers to look at no cost or low cost options. And of course, the purchase of additional MiFis will help us close that access gap for students. And we'll be monitoring that through the fall.
And just kind of one related question, is the technology for students one per household or one per student? Because there are a lot of challenges there.
Dr. Henderson, thank you. And we'll put you on go back.
I could quickly just say that we're looking at providing for our elementary students one device per student.
And Mr. Smith, it's also true those MiFis allow for multiple accesses when we distribute them to a kid. It can be helpful for another family member to be on, correct?
Correct. You can have up to 5 students per MiFi, or 5 devices per MiFi.
Great, thank you. Ms. Cohen?
You can just add me to the go back list already. Dr. Braybrand, I have to say, I'm disappointed about the idea that we are only going to offer online to medically fragile. I will just say I repeatedly am hearing from the community different interviews and things that you have done over the past few months where you've continued to say, if you feel uncomfortable. And so that is the mindset that our families have had walking into this, is that if they felt uncomfortable without necessarily a demonstrated medical need, and I certainly hope that mental health will be considered in those, you know, they absolutely believed that they would be able to access online. So just putting that out there. The biggest one, I really do have 57 questions. I'm trying to condense them, but without knowing what childcare is going to be available, and I've reached out to several of our members of the Board of Supervisors to ask about SAC during the day, but without knowing childcare options, I don't know how we're asking our staff today to turn in their commitments about resignation or retirement without prejudice. And I, as a parent who was also teaching here, an employee here, I could not have worked if my children were not taken care of. So there's no way I could possibly make that decision without knowing what childcare was going to be offered. And the same to families, you know, without having the benefit of that information, I don't know how they're supposed to make that decision. The other, the idea to me as well, the health checks, who is going to staff these, taking in these healthcare forms and checking them in the morning before kids are let in? At Lake Braddock, we have 4,400 students and 17 doors. I don't understand how that can be staffed and people are going through those forms in a timely manner to be able to access them. And I think those forms have the same problem that we continue to see with equity across, of who is able to fill out those forms, how are they able to communicate and understand what's happening. We consistently rely on written translated information when we know we have a lot of families who are not literate in their native languages. So we also need to be doing a better job of video messaging in other languages, of recorded phone messages in other languages, because we are transmitting things in a way that families often still cannot access and understand. And this is just too important with these health surveys. I know other systems are going to try temporal temperature checks instead of trying these health forms, I would just strongly encourage that we look at other options for how we decide, especially knowing that now up 30 to 40% are asymptomatic cases. These forms just seem like an unnecessary bureaucratic mess that we are getting ourselves in. I'm sorry, Ms. Pekarsky, put me on go back.
Okay. We will put you on a go back and go to Dr. Brabrand.
So a couple of things. Let me go back. Medical aid, I hear you. I hear you. I'd love to offer the option. As many of you know, we got the state guidance a week ago. It talked about prioritizing the health need. We're working on the definition of that. We've just got to be sure that we're putting our resources to support the priorities that the state gave in the guidance. And as I said, I don't want to overpromise and underdeliver. Once we get a sense of what the numbers are, there may be a chance for greater flexibility, but I don't want to, out of the gate, make a promise we can't keep. Childcare, we're putting out a survey about that right now to our staff. We know childcare is an issue, and we certainly would want to work with teachers that have, again, we're still actively looking at childcare solutions. And we would do everything we can not to try to penalize our staff. I know the date today is the 15th for resignation. We don't want folks resigning. We want our teachers to stay. We have a statewide, nationwide teacher shortage. We need our folks to stay. We've got to figure out how we can still help them. So I hope to have some better ideas around childcare coming up. The health checks are coming from the state. The state guidance is the health questionnaire. We've got to think out of the box about how to do it. Again, maybe it's a lanyard, that you have around your neck that's in the languages that ask those 5 questions, and you don't put it on your kid unless you've talked and looked at your kid each day. I mean, we've got to decide how many trees we're going to kill. Are we really going to do 190,000 pieces of paper a day and give a new form? I mean, We've asked for the state for guidance. We're going to hope to get something from them. And if not, we're going to come up with something that makes sense. And then I would just say on the temperature checks, I think it's a great secondary tool. We've talked to the health department some about this. Even temperature checks, based on everything we know about COVID-19, aren't necessarily going to be the screener that we think it might be. So I don't want to put a false sense of security to our community about the temperature checks as the end-all be-all. I think I tried to answer those questions as best I could, Ms. Cohen.
Ms. Pekarsky, may I just ask, but will you consider extending the deadline for commitments then for staff resignations?
I'll certainly talk to Mr. Smith and Dr. Nixon about it and provide you an update at the next meeting.
So can we put that as a next step then? To look at the deadline for staff resignation commitments as a next step for the next meeting. Great. Thank you, Ms. Cohen. I've got you on a go back. I now have Ms. Keys-Gamarra.
Thank you. I want to just kind of run through my questions that I have in the first set. I know I will need to go back. I want to start with the technical portion of what we're talking about. When I saw the staff divided out, I saw Mr. Smith and a couple of other folks listed there. And I'm just wondering, who is the technical expert on our staff who is guiding these decisions? Because I think that if we have someone who, I know that we have lots of, we have talented people, but I don't know, for example, that is Mr. Smith's expertise. And I'd like to make sure that we have at least one person who is constantly looking out for problems to help guide our decisions. That's number one. Number two, it seems to me that we really can't put out any kind of plan until we pin down a couple of basic things. Number one, when will we know which staff members are willing to commit to either virtual or being able to be in our schools? And I know that may come with, there's questions as to what answers that people want to have before they answer those questions, but I don't see how we can go forward even tentatively without knowing what staff will be available. So I'd like to know when we will know about that. The other part of it is, when will we understand facilities that could possibly be used? And I'd like to talk just a little bit about one Fairfax, because I do think that this is a community problem. This is an emergency for our community. And we're trying to do everything we can with what we have, but it just may not be enough for the challenge that we have. So have we talked to the county about possibly using some of their facilities? Have we talked to our community organizations about possibly using those facilities and making sure that they're safe and appropriate? Have we talked about looking at what's available and how we need to do even regional or even pyramid analysis according to needs? I appreciate Ms. Laura Jane Cohen's statements about how we are communicating with
Ms. Keys Kamara, I think you froze for a second. Are you still there?
I can begin to answer 3 of her questions if you'd like,
Okay.
Ms. Keys Gamar.
Should we wait till she can reconnect so she can hear the answer?
She needs to be able to hear him, so she's reconnecting.
Okay,
Yeah,
thank you.
Yeah, let's give it a minute. She's still reconnecting, Stella? Do we want to move on to somebody else? Wait a minute. Oh, there she is. Okay, great. Ms. Keys Kamara, are you back?
Karen, are you there?
I don't.
Nope.
She's reconnecting again. How about let me go to the next person, and we can come back to Ms. Keys Kamara. Is that all right? So we'll hold those questions. So up next, after Ms. Keys Kamara, I have Ms. McLaughlin. And if Ms. Keys Kamara, if you're back on, we'll come back to you after we answer Ms. McLaughlin's question. So Ms. McLaughlin.
Yes, thank you. It's been great to listen to my colleagues' questions. I'd like to start at the macro level first. Dr. Brabrand, I'm not pleased on this presentation that there's no discussion of what maybe you've learned about your colleagues around the Commonwealth of Virginia or the nation's top 20 largest school divisions. What conversations are they having around this? Just like the universities have been talking to one another across the nation. So that's missing and needs to be brought to the table by the next work session. I also want to capture what others have said about SAC. We cannot have this conversation in a vacuum. We should have had part of this presentation discussion of what is the county doing about SAC. It is a major resource for our working families, including our working employees. And we need to know what the county's plans are for SAC. I think they will absolutely complement what we're doing. I also think that we needed to have from you a conversation that was more intentful about how the governor has approached our reopening. Originally, it was going to be reopen as one Commonwealth, and he realized that's not realistic in a COVID era. And so we should be having a plan that talks about whether or not we have to do school by school, region by region, where openings and or closings might happen. So that's going to need to be part of the discussion by the 23rd in a more intentful way. I also think that the proposal for scenario 3, as someone else captured, where you're kind of collapsing those with health conditions, but it doesn't really then talk about what scenario 3 is, which is anyone without the health conditions and the desire are going to be coming back to school at what? At full throttle, at 5 days a week. So that part's missing. I also think that the staggered approach, you give us 25%, then 50%, and then there's no discussion after that. So where's the staggering to go up to 75%, then at 100%, and what does that look like? We also should be thinking about, do we want a post-Labor Day opening? Because the information on COVID is changing at a rapid pace. And so we might find that the plans that we want to implement might be in a better position. What I am hearing in Braddock District is our families are very concerned about their children sitting home and not learning. I'm absolutely sensitive to our employees and our families where health conditions are there. But I don't feel that this plan that you've laid out today is robust enough, and we need more. And yes, I'm going to squeak in and say I'm all for what Laura Jane said. Our employees absolutely need to have deferments about their commitments until we get more information for them, and there should be no penalty for that at all from an HR side. And yes, I go back, please.
We're going to go back.
Dr. Brabrand, I do look forward to you responding to my concerns. I mean, things like, why didn't you include anybody from the Wavy schools, Virginia, the nation?
Ms. McLaughlin, I was about to respond.
So let's give Dr. Brabrand a chance.
Yeah. I thought you were moving on to the next speaker.
No,
I was going to ask Mr. Brabrand.
I would never do that. I promise. We've met a lot with our region partners. We've met weekly for 4 or 5 weeks. I can get you all that information about what we're doing. We're really trying to have a similar approach. I've had my team on the large county consortium with the larger districts. So we are trying to very much look at similar approaches, especially in the region. As you know, with the national group, each state is kind of shot calling a lot of their approaches. So it varies somewhat, as you know. Let me go down some of the other things here. We are talking to the county about SAC. We are talking to the county about SAC, and they certainly know how important SAC is to our families and community. So we have begun those discussions. I just don't have all the answers today for everything around what we could be able to do with SAC. We have talked to the health department about a school-by-school approach if there are closures. And honestly, and we have Dr. Schwartz and Dr. Gloria here, a lot of it will be, it depends. It may not need to be a closure at all, depending on what the contact tracing says. Was the kid only there momentarily at the very beginning of the school day and then leaves? So that's a little more nuanced. One of the messaging things to help us with, and thanks because you're great at getting the community piece, is we're not really going to have a bumper sticker that says there's a COVID case of a kid and teacher and it's going to be X. It's going to be that contact tracing that will really decide. Scenario 3, we can flesh out a bit more. The staggered schedule, so here's a nugget for you. One of the biggest things in the state guidance is the 6 feet physical distancing wherever possible. So I'm just going to give you a nugget that I think you'll like, Megan. Day to day, we're at 18 inches. That's what Jeff Plattenberg said. Our day-to-day school normal operations is 18-inch social distancing. So think capacity at 50%. As we start to go above 50% is where we'll narrow from 6 feet to 5 feet to 4 feet to 3 feet. So that's a little bit of us saying, how much would we want to vary that 6 foot social distancing wherever possible? It's possible, for example, in a couple of high school classrooms, would we go to 5 feet social distancing to allow more kids back? And so I think that's just the nuance we're going to need to sit through and kind of build some consensus with this board. How much will you let, how much will the community, the board, the administration, how much will we push the envelope a little bit on the 6 feet? One thing we've heard clearly, even from the state, and we have our health folks, if you go less than 6 feet, what are the additional mitigations that you're going to do? Okay, maybe we'll let you go less than 6, but every kid's got to have a mask on. The teacher's got to have a face shield. Maybe there's temperature checks. So that's something I think for us to talk through a little bit more. And post Labor Day, I absolutely hear you. And frankly, this is a battle between different perspectives and balancing factors. And I'm not ready yet, based on the information we have, to ask for a postponed Labor Day. Frankly, what I'm seeing right now is the data's improving, and maybe it's better to go early. And if we have to do something later in the calendar around winter break, we could do something then. But calendar sets people off, and the data right now seems to say going earlier could actually be better. Maybe we'd have to do something mid-year and could make an adjustment. So those are my first answers.
Great. Thank you, Dr. Braber. And Stella, I believe Ms. McLaughlin was out of time. I have you on a go back list. Is that correct? Next up, I just want to confirm to ask you to bring back the regional approach and what data you have and what our other school systems regionally are doing.
Sure.
And I also have the next step about maybe bring that information on what you're talking to the county about SAC and other childcare options. Did I capture that correctly, Ms. McLaughlin? Thank you. Ms. Keys-Gamarra, I know you had some technical issues during that time, so you have 30 seconds left. I'm going to try to summarize, if I may, the couple questions you had asked first, to make sure we have it, and then we did not have a response to your questions. We were waiting for you to be able to reconnect. So what I got was, who was the technical expert guiding these decisions? When will we know about staffing in terms of who will do what, virtually or in person? And then sort of the one Fairfax concept, or we're a community, what are we doing to get our community partners in our county to help? And that's kind of where I lost you. So if you wanted to finish your questioning, we can turn that to Dr. Brabrand, or correct me if I had anything wrong on that list.
I wasn't sure what you guys had heard. The last part of that had to do, there's two additional things I wanted to mention. One had to do with have we thought about actually how we might be able to capture some of the spaces we won't be able to be in, like the cafeteria, where people might be able to, we may be able to accommodate more students for those who want to be in that environment. And then the last thing I want to mention is in the lessons learned portion of our presentation, I noted that we need to look at things like adaptation for children per their learning style, how we create greater contact in accordance with those needs, allowing for differentiating learning and reaching those particularly who were not reached in our current distance learning plan.
So thank you, Ms. Keys-Gamarra. A couple of things. I think Marty would say he has an honorary doctorate in IT now after the last 2 months. But seriously though, he's working closely with the county IT. The Superintendent Technology Advisory Council has 4 co-chairs who have been CEOs or CIOs who have been, we've been bringing all of our technology presentations to them for review. And Marty's group has worked with them, some of them individually in smaller work streams. We are putting out to staff the issue about who's comfortable or not about coming back to school, and we're asking for it by June 30th, Ms. Keys-Gamarra, so that we have that information soon. We agree with you. We need to know sooner than later to be able to deal with operational decisions. Hill has offered support around facilities with the county. One of the interesting things is, and some of it's the budget, there are some open spaces that where we could spread more people out. Then we've got to have the additional staffing if we spread them. Only pre-K and kindergarten have that extra 8 in the class by default staffing. You know what I mean? In middle and high, we have some team taught classes, but to move kids and then separate them at, say, 50%, you need at least people to go to that place. So it's not as much the facility issue we're running into right now as it is the staffing once you take them to a new place. And then the cafeteria is a great idea. I've got to go back to Jeff and Marty and see what we are looking to do with the cafeteria. I think there could be some room in there to be innovative if we're not going to use it for food. And something we called MTSS, multi-tiered systems of support. We're already working on that data, that attendance data, which I know is, incomplete, not perfect, but we shared it with you in a BB to drill down to each school to identify those kids who were not there, who were failing even before COVID, who didn't show up during the transition, and have intervention plans for them when they get back, right out of the gate. So we are working with our Office of School Supports in our RAS to each school ID those kids. We can't wait for them to come back and figure out who it is. We need to know who they are now based on what we collected from the closure.
Stella, how are we on time?
We are used up your time, Ms. Keys-Gamarra. I gave you a little extra, so we will put you on a go back if that's okay. Thank you.
Okay,
Can I just get clarification on the tech though?
On technology?
Yes, because I hear you saying, what I think I hear you saying is that you're talking to a number of people who have expertise.
Yes.
But I'm one board member, and I think perhaps our board would like greater clarification as to who is advising us to take particular steps, because I believe that this is a fluid situation, and we certainly want to address problems as they arise, and we want to know who to go to get those answers. I'm done.
That's why we can go back to ask more questions around that.
So
Marty, he didn't answer that question. He just said there were a group of people who were talking.
Yeah, Marty, you want to take that in a little bit more detail, could you?
Yeah, certainly. So I would be certainly willing to sit and have a conversation with any board member who's having questions regarding technology. And if there are any specific questions around concerns about what might be happening with technology, I could address those. But really, in working closely with my team in IT, working with our directors who are extremely skilled and knowledgeable in their particular areas, working very closely with the different stream members of the Technology Advisory Council has been a very rewarding part of my new role, leading IT, in addition to things that I'm working with in the system. And then again, working very closely with the county. So I feel like I've gotten good support as part of this process. I feel that we're going down a good road with regard to technology. Again, in working with our current vendors and standing up Schoology pilots for the fall, and looking at some of the needs that our schools might have around that, looking at the needs that our schools might have around additional access for students, whether it be devices or the internet. I feel that I've gotten good support with that, and haven't hesitated reaching out to those individuals who could provide the support that I've needed.
So I'll have a next step on that. Thank you.
And again, specifically, if there are questions that board members have, would certainly entertain having future conversations about those questions so that I could answer those.
Well, maybe for next steps for next week, we can bring some more information specifically on our Technology Council and their roles and how they're working with you, Mr. Smith, and other detail for next week's conversation. Thank you. All right, so next we have Ms. Tolan.
Hi, thank you. Yes, thank you for this approach that balances health and safety, robust learning, and also has mentioned of our working families and how we help those people in our community. One of the things I want to point out, I'm glad to follow some of the people I just followed. This is a huge logistical challenge around, do we have enough right places? Are we going to have enough bus drivers? I mean, to get our kids to the schools? Is our budget going to be allocated correctly? Are we going to have the technology available? Just to name a few. And I want to make sure that we don't overpromise to our community. We've had an issue with that in the past. That we put together this incredible plan and then we don't have the logistics to back it up. I'm very concerned about the fact that a lot of our staff is off. Our 11-month staff, our EPs, they're all off for the month of July. So I do want to make sure that we've got enough staff in our schools and that we have the budget to pay for that staff to make sure that we can plan for this to happen realistically.
One of the things, I just want to throw an idea out on the table. I was just trying to, in my own mind, trying to problem solve, you know, how we're trying to educate our kids the best that we can, how we're trying to be safe, but how can we help our families? And most of our school sites are relatively large campuses, and we have a lot of outdoor space. So whether we use that outdoor space for classroom space, we rent it, or we coordinate with the county to provide childcare on our sites in an outdoor setting. And, you know, with the weather uncertainties, whatever, we will probably have to provide tents. But we've got the space, we have Wi-Fi, we could perhaps have solar chargers for the laptops. Maybe the county runs a program like SAC, but we need not just before and after school, we need all day childcare available for families on those alternate days, and we need it for our staff. We'd have to, of course, you know, time the drop-offs, pickups, figure out all the lunches. But this could be an opportunity on those alternate days where kids would have help with their homework. They would have outdoor play and outdoor education. We have about 125 of our schools with a park close by. Perhaps we coordinate with the park authority as far as staffing some of these activities, use GMU, students for staffing, etc. We know outdoor activities are less likely to see the spread of COVID. So, you know, there could be a lot of positives around this. Just trying to throw another creative idea on the table, of course, another one with huge logistics associated with it. But I think in our conversations with the county around childcare, this could be helpful. All right,
Good time.
other questions?
I'll put you on a go back.
There you go.
Thank you.
So, Ms. Tolan, those are that last thing's a great idea. I don't know that we've explored that at that level of detail, and especially at the beginning of the school year when the weather is warm. Again, we don't know whether the vaccine's coming in September, in January, or not until next year. But certainly in the beginning of the year when the weather is warmer, is there more flexibility with some outside ideas? I think we need to take a look at that idea and bring it back with a little more of our reflection. So thanks for sharing it. On the summer one, we have reflected. Back on the budget slide, you'll see it's like $2.5 million for summer registration and scheduling. That's to pay for DSSs, Director of Student Services, APs, all the people that are not any longer on 12-month contracts because of budget cuts a few years ago. We've put in to get schools hourly to bring back those people they need to get the master schedules set up for the summer. So we realized we couldn't ask principals to do all this stuff this summer by themselves without staff. So that 2.6 million's on there. The other thing you and other board members had advocated for, you see in the budget for the SBIT, even for those small elementary schools, a full-time SBIT. So they can come on and start getting ready to help teachers with all that technology that they need to do, regardless of what scenario we're in.
Thank you.
Great. Thank you very much, Ms. Tolan, and I have you on the go back list. So next I have Ms. Marion.
Yes. So coincidentally, some good points I want to talk to just raised. So one is that I want to echo what I heard at least Ms. Gilbert Sanders and Ms. Cohen speak to, which is about the options that parents want, which is to return if they don't feel their student is safe. So I very much do want to see an option for students who want to opt in regardless of whether, or opt out and opt into the distance learning regardless of medical need. That is something I've heard a lot of parents ask for. The second thing is about childcare, and Karen Kisomara said this very well, that you know, this should not be all on the school system's shoulders. This is an issue for society. And I'm happy to be on a town hall a week or two ago with Cornerstones and Reston with Supervisor John Faust, and I wrote down the quote because it was so striking. And he said, providing childcare is one of the most stimulating things we can do for our economy. And I know he's a longtime proponent for childcare, but I would like to know what specifically, you know, I've heard you superintendent speak about we're trying to do and make things happen, you know, what has been done and what can we as a school board do? What can we ask our elected officials to do? And what can we ask our constituents to do to make this a more group effort? You know, we've all talked for years about the value of childcare and early childhood ed, but we have not lived that value. And to do it now would be a very different way of supporting that. That would be welcome. The other thing I want to mention is I know they will be samples, but the hour straight for pre-K through 2 in the agenda, I could tell you as my first grader went through this, it just does not work. I'm really surprised to even see it as an example. So I would love to see more guidance or even request that those classes not be an hour for those little ones. And finally, I'd like to know more about the SBITs. And Ms. Bird and I had emailed you about this, and I'm not clear. I thought in the budget, we approved 1 SBIT for elementary school. And I'm hearing from principals that indeed they are not funded for that. I think I heard that the number was it 13 and a half more SBITs for the elementary school funding, if I heard correctly, than Ms. Burden said. All I want to confirm is every elementary school going to have a full-time SBIT in time for the fall? And are the job descriptions up already to start hiring that? The last thing I'll say, do I have like 10 seconds, is the message from the state's guidance. Okay, good. The message from the state guidance is this. They say social emotional supports first. And so I just want to underscore, primarily for the community, that as others have said, this is not going to be ideal. We really do need to consider the stress that this has on everyone involved, especially our kids. So I know we all want academics, but that's social and emotional. We've got to consider the stress on everyone in the situation. So we'd love to hear about SBITs and the childcare work happening. Thank you.
So thank you, Melanie. If you guys provide consensus, and it could be today, meeting, however you want to do it, I've brought you the budget placeholders for CARES and the COVID reserve. I've shown you that before, but I didn't feel we had approval from the board. So once you all green light that, we can fund the SBITs for every elementary school. That is in the budget.
I'm sorry, Dr. Brabrand, you're breaking up.
Oh, okay. You guys can't hear me?
I heard him.
It's a little crackly, Dr. Brabrand.
People need to mute themselves. I think that was the issue.
All right, I'll try one more time. If the board greenlights the budget today or at the next work session, we can move forward with SBITs. It was shown before, but we didn't move forward because we hadn't had all the final numbers. We're ready. If you all approve, we have money to purchase an SBITs for every one of the schools. So it's not in there, but it could be.
Can our budget chair speak to that? Am I the only one confused about that? I thought that was a done deal.
Ms. Burden?
And also Ms. McLaughlin, perhaps, but I just thought as a matter of school board process, that was a done deal.
Yeah, Dr. Braven is absolutely right. The budget included, as I mentioned, the 9.3 million in COVID recurring funds, and the SBITs for every school, the additional 13.5. You know, we're recommending that those be funded out of that placeholder, as well as the additional T-specs for elementary schools that are greater than 750. But those funds are were approved in the budget in a placeholder. So in order to establish those positions and get them posted and filled, requires approval from Dr. Brabrand or the school board, so that we can move forward with that.
So if the board directed me today on those budgets, it's kind of where the board wants to go. You're good. This is our final approach of the budget with what we have. If you like all of it, some of it, I'd like to be able to move forward as soon as possible, to be honest, because some of the staffing, the sooner we can hire, the quicker they're in schools. The issue, I could bring Maura Burke, our Director of Early Childhood, to the next work session and talk a little bit more about childcare. One nugget she told me is there is still childcare capacity in our county. So part of this, we need to better connect, like John Faust said, what childcare exists in the networks with the people who need it. And how can we better do that is something we're really talking with folks about right now. And then the other, thank you for the feedback about the option 3. And again, I just want to say it this way, just being plain spoken, I learned a lesson about over-promising, under-delivering we've got to be sure we can scale a massive virtual learning experience for any kid if we wanted it. Wow, if the percentages were huge, would we be able to deliver? And that's the part that I'm just not comfortable today saying that without knowing how many kids with severe medical needs are going to be and need to be at the front of the line. So I hope those answer your questions, whether they're completely the answer you wanted, but answered your questions.
Dr. Baker, I would like to see if Ms. McLaughlin or even Ms. Corbett-Sanders can speak to the.
Yeah, I would like to speak to the question that Ms. Marin asked about the budget placeholder for our COVID funding. So as everyone's aware, the federal government has basically given us a combination of recurring funds and also one-time funding in COVID. And it's well over $28 million. So when the budget Vice Chair Ricardi Anderson and I reviewed some draft plans from the superintendent and the CFO, we did say that this is something that we absolutely agreed in prior budget conversations that the superintendent would bring back to the board. So I understand where Ms. Marin's coming from, and I understand what Dr. Brabrand's saying, greenlight it. But the goal all along was that as budget chair and Dr. Anderson as vice chair, we don't make those decisions for you all. We as a board make those decisions. So if this was a time sensitive issue, just like this board was brought an emergency purchase request on laptops for elementary school students, this was no different. So Ms. Marin, I'm glad you brought it up. I'm glad you've heard from your principals. I will tell you that I've heard nothing from Dr. Brabrand or our CFO that this was something that needed to be done right now and need to be put in front of the board. I'm not standing as an obstacle on any of this. So
if I may interrupt, I think if we can get back to the questioning, I think maybe for a next step, we need to have Dr. Brabrand talk to our budget chairs and vice chair, and for the next meeting, bring back to us specifically budget asks that we need to give votes on. So if maybe we can work offline with Dr. Brabrand and Lee Burton with our chair and vice chair on that piece and bring it back for next time. That would be my thought.
I absolutely agree.
If I may add one more item.
Dr. Anderson, if it's relevant, but I'd like to, we've got people who've been waiting for a while, so I'd like to maybe get back to that and maybe we can work offline on this.
Well, let's keep it, let's finish the conversation on this.
I don't want to get detailed on the side notes. If we can work offline with Dr. Brabrand and Lee Burton on this and then bring it back, that would be great.
Dr. Anderson is budget co-chair, is vice chair, so I'd like to hear what she has to say too.
And I will be super brief. I just want to bring your attention back to the presentation that we had on the 21st that outlined the COVID CARES Act placeholders, including the PPE equipment, including this SFITs. So we did want to have opportunity to come back and engage in this conversation when that was fleshed out a little bit more, because they were still very much estimations at that point. And that's where that SFIT at every school lived, along with the social emotional curriculum that we're discussing today, as well as some other curriculum resources. All of those were together as one package for the COVID, which we need to give permission to at another point. The timetable was not set that we needed to have it now, but it did live in this conversation that we will need to act upon. It was not part of our regular budget work.
Okay, thank you, Dr. Anderson. And I think the best way to bring that up is to talk about it.
I think our chair would like to pop in here.
Yeah, I'm sorry. And I just, thank you, Ms. Marin, for raising this. I think where the confusion is as you said, Dr. Anderson, back on the 21st or the 11th, I forget which date, we were told that these SBIT funding was going to fall under the CARES Act. The challenge is on page 55 of this document, of this presentation, it calls for those SBITs. It doesn't fall any longer under the CARES Act, but has now been moved over into an unmet needs and new funding. So that's where the confusion, I believe, is coming from. And I'm sure that Dr. Brabrand and Ms. Burden are going to be able to add clarity as to how that happened. Does that make sense?
Yeah, that makes sense. Dr. Brabrand?
Yeah, I mean, Lee, I don't have it in front of me, but I think the bottom line is all these variables have been changing around, we believe that the SBITS was still a priority. We may have changed the pot of money. I think we moved the SBITS to the reoccurring fund because they're positions. So once we hire them, we're going to want them each year reoccurring. So we moved it out of CARES one time into the COVID reserve that's reoccurring dollars. One thing the board can think about, I mean, either today or the next work session to green light these positions that we're asking for, the SBITS, the T-SPECs, the psychologists, if you want to, so that we can get on to the hiring and separate that out from the other expenses, which we can talk about next week, or we can meet with the chair and vice chair of the budget and bring back recommendations for all of it at the next work session, whichever your preference is.
I think that can be, I would think that perhaps we need to have you meet with our budget chair and vice chair and get more of a discussion as to where, what the changes may have been from our previous presentation in terms of the placeholders as well as the CARES fund, and then we can have that discussion at our next work session.
And Lee may have something to add. Lee?
Yeah, I'm looking at the presentation from 514 where we laid out a tentative plan, and both of the SBITs and the full-time T-SPECs, as well as the counselors and the psychologists, which are in the same position, no pun intended, because they are positions that need to be established so that we can recruit, post for them, and hire people into those positions. At that point in time, those were all in the recurring costs, which are locally funded, not federally funded. But my recollection is that with the discussion with the Finance Committee was that these items needed to be discussed by the full school board before we could move forward. And I believe at that Finance Committee, recruitment concerns were discussed, but it was decided that the full school board would want to weigh in.
So if I may just pop in here, I want to do a time check. Thank you, Ms. Burden. It's 4:20.
Take this offline, but I'm very uncomfortable about how this is being captured. And there is no way at any time that the budget chair and vice chair ever said we would delay important hiring purposes. That's very disappointing to hear.
Ms. McLaughlin, what I was going to say is I absolutely would like this discussion to take place with both of you and Dr. Anderson, and this to come back next week for full board discussion and bring us back to the fact today we really are looking at the bones of this plan moving forward, and to just kind of refocus us on the larger issues, because it is late and we will have another work session. So I appreciate that, and these are definitely important questions.
I agree.
Next I have Mr. Frick.
Sorry, it sounded like a lawnmower for a second. Thank you, and I want to thank Dr. Brabrand and the leadership team for their work on this and for acknowledging from the jump that there were deficiencies in the rollout of our distance learning plans, and that we need to have more consistent implementation, more synchronous learning, better access to MiFi and technology, better communications, underscore, italicized, bold print, and a stable platform. You know, one thing that I think also needs to be done is to express to our families how much more complicated the work of our teachers, our educators are during distance learning. So much is not seen by families and by folks who are not in the shoes of our teachers. They don't know what goes into planning a day of distance learning versus what would typically go into planning a traditional school day. But Dr. Brabrand, you did say that you want to make sure that you've learned your lesson about over-promising and under-delivering. So to that end, I'd like to do a little exercise here where we kind of get a little more granular on how these things might look in practice. And the three areas I'd like to focus on are the health checks, social distancing, and the technology. So starting with the technology, and this maybe Marty can jump in on as well. What steps are we taking right now to make sure that the pilots of Schoology are being troubleshot for any and all of the problems that we experienced with Blackboard at the launch of distance learning in March?
Marty, why don't you take that one, if you would, please?
Sure, certainly. So we've been working very closely with the leadership of Schoology and are prepared to bring them in to have a discussion with the board to talk about our efforts around that troubleshooting, to give the board and the community a better sense of how we might mitigate any challenges that we encountered with the rollout of distance learning this past spring. So we've been working very closely. We have a team set up where we're working with Schoology, working with our pilot schools, getting some of the requirements from our staff around what their needs would be around the rollout of a new LMS, working very closely with our stakeholders to, again, build out the plan for implementing our pilot program and thinking about what those next steps would be. So we have a very clear plan that's been created on the rollout and the creation of the pilots. We have a clear plan where we're working very closely with the project development team at Schoology. We have guideposts along the way. We have meetings along the way that are regular, and again, are prepared to bring our Schoology partners in to have that conversation with the board and the community so that we can all rest assured that we won't have the same issues that we encountered with the previous rollout of distance learning.
Mr. Frisch and Marty, correct me on this if I need to be corrected, which sometimes I do. Mr. Frisch, one nugget of this is Schoology's new LMS, which we did go on to our old LMS 24/7, and then we had load issues that killed us. Blackboard Collaborate is our web conferencing tool to do the face-to-face. That's still going to be with us one more year. We've got to find a new web conferencing tool to get married to Schoology. So we're pivoting away from all of Blackboard, both the learning management system and the conferencing tool. We're going to have Blackboard Collaborate still next year, but Schoology is going to be piloted. If Schoology goes well, Schoology becomes the new LMS where we have all the lessons and materials, but we're going to also have to find a new web conferencing tool. And that's one of Mr. Smith's biggest priorities as we go into next year. By the end of next year, what is that conferencing tool and can it handle the load? Is it Google? Is it Microsoft Teams? Is it a combination of multiple groups? That's what we've got to have answered sooner than later, and Marty is on top of it.
And we feel confident that with our tools, so Google really won't have any issues with our load based on the schedules that we've provided. We're working with Blackboard now. They've reviewed our schedules. They don't feel that they will have any issues with our load based on the schedules with regard to the virtual conferencing portion of distance learning. The LMS for Blackboard will remain the same next year for all of our schools, save for those schools who will be piloting Schoology for the full rollout of Schoology in FY22.
And just to be clear, so people watching at home know, LMS is learning management software?
It's the learning management system, yes.
Yeah, and I just want to be 1000% clear, because many of the things that you've said are things that we were told in the rollout of distance learning. And that we were told by vendors in the rollout of distance learning, right? So, you know, in the words of a former president, trust but verify, right? We need to make sure that everything we're being told by these vendors is double and triple checked, because we can't risk another failure like we had before. Second area of questions I'd like to get into are this idea of social distancing in our schools. And I think we all agree that we need to get into our schools as quickly, as safely as possible. But I think we're being a little rosy in our disposition about how social distancing would function in a school. For example, glossing over the idea that we'll just have kids walking in one direction down a hallway. Right now, it's not even two directions. It's more like pinballs, right? They're looking at their phones, they're bumping into each other, My partner's a teacher. He comes into contact with more students in the hallway through bumping into them than he has in his classroom. How are we going to make sure that these social distancing initiatives are enforced in a reasonable way that parents can expect it will happen? Because I guarantee you, the thing I'm hearing most from parents is that.
Thank you.
What put you on to go back to?
So Carl, let me take that, because you nailed it. And this is our communications we need to do better. I cannot guarantee 6-foot social distancing at all times. Any school district that's being honest today, there is no school district who can guarantee when their child is dropped off at school that they will be socially distanced at 6 feet at all times. It's not a guarantee. Here's our thinking, Carl, though, about the hallway passing, especially for high school, because we believe we're going to still have kids mix. The phase 3 says consider restricting, but we want kids to go to all those elective programs. And if you just stick them in one classroom, they can't keep going to all their different sections. But if you move in the hallway, we may ask or require students to wear the mask while transitioning. So that could be a mitigation strategy that we would say, you must have your mask on when we do hallway changes. But that's the kind of communication with the community we're going to have to do, to be about what we are saying we can guarantee and what we can't. And 6-foot social distancing wherever possible is our best attempts. It's not going to be a guarantee.
Thank you, Mr. Frisch. Next, I have Ms. Omesh.
Thank you. Thank you to our staff, Dr. Braybrand and the team for putting this together. I am encouraged by a few things, starting off with the lessons learned, contingency planning that we saw, comparisons and study of other divisions across the globe, and sharing, of course, Ms. McLaughlin's desire to see local ones. I even noticed, some of the details as to making sure we don't use more buses than we have and that kind of thing. So I commend Jeff's team for that, Mr. Plattenberg, and everyone on this team who's been working hard. As we look ahead at future work sessions, I wanted to just delve deeper into a couple of things and suggest maybe more thorough analysis. One is, in looking at the state plan and what it requires of us, there were two particular stipulations, one of which was the point, literally, this plan must also include strategies to address learning loss due to spring 2020 school closures. I'm not confident that we have a specific plan to address that piece. I want to make sure we cover that, and certainly to whatever we submit to the state and in our own discussions. Another piece I would love to see a more specified timeline. When thinking of timeline, not just the phases as we move into schools, but even internally, our operations, our communications timeline. So, for example, laptop distribution deadline, internet access verification, making sure all our students have that. I'm also mindful of the shortages that exist with PPE and sanitizer and things that we were guaranteeing on slide 9. When is the timeline for purchase, right? Having all of these things worked out operationally and presenting that as a part of the plan, I think could be beneficial for anticipating potential challenges moving forward. I would, thirdly, look into the communications plan and hoping for more specificity. What are the check-in points for the community? For example, we have the public hearing on Thursday. That's an opportunity. But as we move forward in engaging stakeholders, I noticed the slide on this and think we could benefit from a little bit more. Slide 52, I believe. Fourth, in terms of the utilization of HR plans and rules, it was touched upon that staff who may be fearful, guarantees to not having certain contracts impacted. I think that's an important piece to make sure we comment on. The second is in terms of what are the roles going to be? How are we utilizing our social workers? How are we utilizing our counselors during this time? Having maybe a more delineated plan as to what each employee in our building is going to be doing. And even keeping in mind, custodians, for example, who are going to be even more needed if we pick certain scenarios. Fifth, I think it would be beneficial for us to develop assessment criteria. What defines a successful rollout to us, and what metrics are we going to use to analyze that? I think could be useful. And I hear my time, but I certainly want to.
We'll put your go back.
All right. I'd love to hear some feedback on these points.
So thank you, Ms. Omesh. One, the learning loss, we are going to submit a plan around to our instructional plan to the state so we can get that to you guys. I mean, we just got it last week that we have to do it, so we're working on it. But we could bring some of our folks around MTSS from Sloan's group, from Mark Greenfelder's group. But we're already pulling individual kids in schools, identifying them to be able to provide the supports. And we have the support dollars in that budget slide, hourly teacher pay to give additional interventions for those kids. The timelines, that's where everybody is, to be honest. If you're a school superintendent right now, every school board wants every timeline and date down to the detail. And we're just 6 days into the governor's 150 pages. So all that has to happen. When we have it, we'll share it. But it just, we haven't finished. Obviously, we need all of that stuff in before school starts. And we can start to give you those timelines around the laptops when they arrive in July. They've got to be re-imaged, distributed to schools. We'll work to give you that. We are planning to keep the task force going, the 60-member task force that Dr. Ivy and we're going to keep that going through the summer, at least weekly, so that we can check in with the community and get the pulse, even as we're going along after we do this initial flurry of surveys. And we're thinking about even keeping it during the school year, maybe not weekly during the school year, but just as a group to keep checking in with. The health department's been on it, parents, teachers, kids, school board reps, school board members. We're thinking, that's what we've been thinking about, unless the board tells me otherwise. I think I'd like to keep it going for a while. And I have talked to HR since this board meeting began. We can work with teachers after the 15th if something comes up. We'll figure out how to work with them beyond this 15th date. There is some work in the Virginia code that gives the superintendent some flexibility, and I will work with HR around that. And then the metrics, that's a good piece of feedback. I don't have the answer for all of that today. One metric would be no emails to the school board with concerns, but I don't know if I'm going to put that one down or not. But yeah, Rachna says yes, but let me see. But yeah, we'll work on some of that and bring it back for the next week's meeting as a next step.
Thank you.
Thank you very much. Before I take my turn, Ms. Pekarsky, I'm going to give you your chance. Were there other questions that didn't get answered from Ms. Omesh? I think all of them got addressed.
Yeah, I think they're mostly next steps to look at in the following presentation. So thank you.
So Ms. Pekarsky, I'm going to give you your 3 minutes and I'm going to time you. So, and then after that, go ahead.
Okay, great. Thank you. And thank you. You know, I've gotten to speak with staff in preparation for this meeting. Just some high level things. Personally, I am very interested in, you know, getting kids in school as safely as possible and keeping kids safe, keeping staff safe, while at the same time doing what we are supposed to do as a school system, which is provide that high quality instruction. So, and I would say that for that high quality instruction, we need to be in school buildings. So I appreciate the work with our health department to find ways to learn how to live with the disease, with this disease, and still do what we need to do to educate our children. One thing that I had concern about was the face masks. I guess the governor said suggested. The reason I have concern with this is because speaking to healthcare providers, they have all flagged this as the single most effective way to stop the spread of disease. So when we put suggested, I am worried about that and what that means to individual staff, kids. So if you want to take that, Dr. Bray-Brown.
Yeah, so one thing the state allows us to do and the school board to do, we can go stricter in the mitigation strategies than the state. We could require In fact, I believe already we're suggesting for the bus trip that masks will be required of kids. So we could require that at all times, even when they come to school. That's something we need to, I think, discuss and decide as a school board. I'd like to do that with you versus it becoming a staff versus school board item. How strict do we want to be about the mask? I do agree. A lot of the research coming out does seem to say that that is a very, very effective mitigation strategy. And how much do we now? There's some opt-outs for kids with breathing problems, or if we go stricter, we need a little bit of room for potential opt-out for legitimate reasons. But we could certainly work with you. And as Carl said too, it could be highly recommended during class time, but required on the bus, required class changes, required entering or leaving the building. I mean, so we could come up with scenarios when it must be on, or when it is expected to be on.
Sure, and I know there are times they're uncomfortable. We want to find that right balance, but we also want to make sure that we are doing what we know scientifically will stop the spread of disease, because things like social distancing can be extremely difficult and sometimes unrealistic. So I don't know if our doctors are still with us and would like to talk to that, but if not, I appreciate the conversation.
Dr. Gloria or Dr. Schwartz, do you want to say anything about face masks or face coverings rather?
Okay, no worries. We can save that, but I just wanted to flag that. I would also like to say I would like to see flexibility for families who do not feel school is safe, and I understand that we do have limitations. But going forward, after we know and the survey results are in, please keep that conversation going. I am also concerned about buses and what that looks like, and what happens if a child comes on the bus and they are sick. That's kind of our first touch with kids. And will the bus drivers be trained or have any tools to do anything with that?
So the buses is something we've been talking about. One, about requiring the face mask. Two, about face shields for the bus drivers. We looked at shields to encompass the entire driver, but the Virginia Department of Transportation is saying that's a no-go, that it's a hazard, it blocks. And by the way, the face shields we're talking about for bus drivers would be non-glare. So it would be a non-glare face shield that a bus driver could use. We'd also have the windows down on the buses to have better air circulation, and that would be a requirement. So we're going to keep looking at the bus strategy, and we can provide additional update next week.
Excellent. And one question that I've gotten a lot, and this may seem like an obvious one to us at this point, but parents want to know, they need to go back to work. Childcare is an issue. Why isn't 5 days a week an option in some way for kids? So I would like you to address that for our community.
The simplest way I'd say it is back to what I said to Ms. McLaughlin earlier. I can do it at 18 inches. 18-inch spacing from kids, we can be back in school 100%, right? We probably could be at 90% with 2 feet. 80% these are numbers I'm making up now, but get the idea. 80% capacity at 3 feet, right? If the state had said 3 to 6 feet, we could almost be back every day. So it's how much we want to waver or vary from the 6-foot social distancing wherever possible that dictates ultimately our capacity for kids in the building. That's the best way I can express it in simple terms. And I think that's one of the things we have to decide. We can get more capacity with less social distancing. But that's been seen as a very positive mitigation strategy. That's the trade-off.
Right, and that's the trade-off that I think we need to discuss, balance with wearing the face masks.
Right.
That's a conversation I would like to really delve into.
Okay.
Your
No,
time is up, sir.
I've hit my time, so.
We can do more of that next week.
Thank you.
Stella, do you want to go back?
Sure, thank you.
Thank you. Stella, are you timing me? So I want to just pick up a little bit on what Stella ended off with the 6 feet of distancing. Correct me if I'm wrong, but my understanding from the state is the guidance is we can be more strict than the state, but do we have room to be less strict than the state? Because my understanding is the state is saying in phase 3 we need to abide by CDC guidelines, which is talking about the 6 foot distancing. So if you could address that question first, I'd appreciate it.
You know, again, Teresa or Sloan, who've read all the CDC guidelines and state, I believe we can be. Let me let one of them take a stab at that first, and then I'll add. But my recollection is we do have flexibility again around how we interpret that 6 feet. Or Teresa.
Yeah, I think the first thing I would say is the key part of that guidance is working with your local public health officials. So we need to be working with the county health department to figure out, you know, based on our health data and trends here, what's the most prudent course of action for us to take. Then when you actually look at the language that's in the governor's plan, and I included it on one of the earlier slides in the presentation, in phase 1, the language is 6 feet of separation between desks, tables, and workstations. When you get to phase 2 and phase 3, they drop the language of desks, tables, and workstations and just talk about 6 feet of separation whenever possible. So, you know, a plain language reading of that would say that there's increased flexibility when you get to phase 2 and to phase 3. But I think as Ms. Pekarsky kind of framed, that's the discussion really, and as Dr. Brabrand said, that the board really needs to have. And again, continuing to partner with Dr. Gloria, Dr. Schwartz, and other folks from the county health department about the most prudent courses of action.
Great, thank you. I just wanted to get clarity on that for anyone who's watching in terms of what our parameters and requirements are as we go forward in planning. I wanted to ask, when we talk about scenario 1, which is all virtual learning, that would also be the scenario if there's greater outbreaks or waves or things like that. Is there some sort of option for in between scenario 1 and 2 for those groups that really can't learn in distance learning, our ELL students or more impacted SPED students, that where we may not be safe to be in scenario 2, but can be somewhere in between those 2 scenarios?
Yes, absolutely. We could end up having something between scenario 1 and 2 where you're only bringing back those kids, but that's going to be its own. Just think about EL learners and what we've heard from the health department, that our Hispanic community is the most impacted. They're the most impacted by COVID. They're also the most one of the many impacted academically. So you bring them back in face to face as a priority group. But I'm just, even that has its own balancing of factors. Do they want to come in? Are they going to feel more at risk to come in? But I want to go back on one other thing. There is some language, and I'll get it for the next meeting, where the state has sent something saying, if you want to have an intent to vary on the state guidelines, you can submit that to the state. Sloan, I'll double check that. There is a form about the intent to vary, and we can bring that back or share that with the board later this week, so you can have it as part of a discussion at the next work session.
Thank you. I just wanted to, my concern is I've heard from a lot of the community that there's some students, younger students particularly, who can't access distance learning. And going forward, if we need to go back to distance learning, it would be good to be able to have options where we have even more limited in person if we need to. My preference would be to try to get our schools open as much, because in a safe way, because safety for me, for our students, means safety from COVID, as well as safety from child abuse and our mental health issues. So I think we do need to balance all of those scenarios when we're looking at getting our students back in our building. The next question I had is, when you're looking at logistics, have you looked at, and this goes a little bit to Ms. Keys-Gamarra's point about using other spaces, the realities of some of our smaller classes where we have our self-contained population sometimes, or our pull-out rooms? Have that been considered in when we're looking at logistics?
Teresa, do you want to say anything about, or Jeff, about the self-contained classrooms in space, I think we're in better shape than we might think, but let me let Teresa or Jeff answer that.
I'm going to have to ask Jeff to respond because his team has been looking at the classroom space issue.
Yeah, basically, like I said at the beginning when I was asked by another board member about, we really took a broader view in the timing that we had with the action teams that we did. But that's one of the reasons why some of the other spaces that are mentioned, like if we look at the cafeteria, we looked at that as some of the swing space where when we get into more granularity, we might be able to have accommodations for other spaces within the facility and freeing up potentially a larger space for the ones that you mentioned, and putting other students in the cafeteria to free up that space, in addition to the potential for the expansion of SAC and the social distancing of SAC into cafeterias and the like. So we did take a broad look at it, but again, we'll have to work with individual principals and looking at their master schedules and trying to figure out exactly how to work that out. And we didn't believe that there were that many clashes, but we do know that we will have some that we'll have to work through.
Hey, Jeff, a nugget for the board though, because a lot of special ed classes are say 10 kids or 8 kids. If we have that whole class in there in special ed class, we may still be able to meet the 6-foot social distancing recommendation. Is that correct?
Oh, that is correct. I mean, most of our spaces that are designed appropriately, we currently have over 30 square feet per child. But again, the needs associated with that child and the impact on it, again, depending on the services provided. But for the most part, yeah, we took a look at that, and the space per child was, square foot per child, was much greater for those classrooms. You're spot on, Dr. Berman.
Yeah, thanks.
Great, thank you. I wanted to kind of bring up another topic is when you're, again, broad level, when we're discussing these plans, did we look at what some of the colleges are doing in terms of having a longer winter break for potential outbreaks and going into the summer? I'm also bringing this up because I have some real concerns about both the need for remediation with the learning loss, especially considering that our summer programs are virtual, as well as teaching our standards for next year, especially again for our vulnerable populations. So can you speak a little bit to what plans we might have to remediate for those, all of those students, but especially longer term, those who really need it? And are we looking at calendars and other sort of creative options for that?
So let me take the calendar, and then Sloan, if you want to talk about some of the remediation plans and the intervention and supports. I'm not prepared this early to make a major change to the calendar. I feel like so many things have been changed. To keep the calendar as it is for now is still the most prudent. And the data that I'm seeing, and I see Dr. Gloria is back. The data I am seeing makes me more optimistic for getting back in August than less optimistic. So shifting the calendar to later in the fall, I don't see that right now as the play to make. You know, you mentioned, and I mentioned to Ms. McLaughlin, if things get worse in the winter, would we want to have a bigger winter break? We have a 2-week winter break. Would we go for a bigger winter break and then maybe something different in spring break or in the latter part of June? But I'd rather be honest with the community and say, let's look at those changes as this develops versus making a change to the calendar now without health information moving forward. I don't know, Dr. Gloria, do you have, do you want to add anything to that or a different opinion or perspective?
So I have to apologize for stepping out of the room earlier. I heard my name as it related to the 6 feet social distancing, but I didn't get to my computer early enough before you all moved on. So if I could say something about that, I think as you go along, that it's important to keep certain guiding principles in mind, and that is that the more people a student or staff member interacts with, and with the longer that interaction, the higher the risk of COVID transmission. So obviously the lowest risk is the virtual learning activities. And then as you bring people on board, that also increases the risk, with the highest risk being, full-sized in-person classrooms and so on. So it is important that as you consider options, that the 6-foot social distancing be maintained, and then look at how best that activity can be achieved using or maintaining that 6-foot social distancing. And then the face covering comes in, as the CDC guidance has said all along, is that if you find yourself that you are unable to maintain that social distancing, then it's imperative that you have the face covering. And I believe, Dr. Brabrand, you were talking about, oh, I forget who it was, but you all were talking about examples when that would be enforced, which is like when they're passing through the hallways or they're doing some other, yes. So I think, you know, again, you have the option of doing, you know, of setting your policies around the CDC guidelines as the bottom of that policy, and that you can be more stringent. But I would suggest that you all stick within that 6-foot social distancing parameters as best as you can, with the exception of what you talked about, which is passing in the hallways and doing that if it is not possible. But I think even then, I think with a little planning, you know, kids can be let out in a more orderly way that does not, or that limits them from turning around and facing each other, but all going down a certain direction.
Thank you. That was my concern when I asked the question earlier about, you know, CDC guidelines and remaining within them. One other question that I have, again, when we're talking about in between scenarios, I've gotten a lot of complaints from the community about the difficulty of IEP meetings, eligibility, these meetings. So I'd like to sort of emphasize that we try to at best have those in person with safety guidelines, and I'll take a go back for the rest of it. I just wanted to say that was the last one. I don't know if you want to comment on that, or just I just want to put that out there. I know we've been going for almost 3.5 hours, so I was the last one to speak. I would suggest, Stella and I messaged about this, that we take a maybe 10-minute break. Stella, you think 5 or 10-minute break, and then we'll go to go backs, and we'll limit our go backs to 1.5 minutes. I know there's lots of questions. I have pages as everybody else does, but we do have another work session on this next week. I would like to emphasize also that we have our health department officials here with us today. So if there's health specific questions, it might be good to focus on those for our go backs as an initial, and then maybe other questions as we have them. And again, we can go more granular next week as well. So I just want to put those few things out there, but we'll maybe take a break. It's 4:56, so maybe until 5:05, take a break, and then we can come back and do 1.5 minute go backs. Any comments or thoughts? Yeah, Dr. Brabrand?
That sounds fine. A 10-minute break would be a nice thing.
Stella, too long?
I think that's fine. Thank you.
Thanks. So 5:05, if we could please come back, and we'll do 1.5 minute go backs. Thank you, guys. you could lower your hand, that would be helpful.
Because people left the session, Ms. Eismer-Heiser, what we will do is we'll do a quick roll call so the public knows everybody's back.
It's 5:05. Ms. Corbett Sanders, would you like to go ahead and do that roll call, if you don't mind?
Sure.
I'm happy to do it too, if it's easier.
I can go ahead. Dr. Anderson.
Present.
Ms. Cohen.
Here.
Ms. Derenak Kofax.
Here.
Mr. Frisch.
Here.
Ms. Keys Gamara. Ms. McLaughlin. Ms. Marin. Ms. Omesh. Alive. Ms. Pekarsky.
We need you to giggle.
I'm here.
I'm sorry. Ms. Tolan and Ms. Omesh, I'm so glad you're still alive. Ms. Tolan.
I came back.
And we know Ms. Eismer-Heiser is here, as is Ms. Keys or Ms. Corbett Sanders. Ms. Boateng.
Here.
And Mr. Anabundo.
I'm present.
Wonderful. We can go ahead and get started, Ms. Eismer-Heiser.
Okay, great. Thank you. I'm going to go straight into go backs. And just again, a reminder, we have health department officials here. We'll have a minute and a half for go backs each, and we do have another work session next week as well. I'm going to try to capture next steps, but if you have any specific next steps, if you could share those with staff, that would be helpful. Thank you. And first I had Ms. Jonah Kofax for go back.
Thank you. Thank you. My questions, I did ask the health department first. I'm going to ask a facilities, Mr. Plattenberg, right now. Jeff, this one student per bus seat, I don't believe that is 6 feet. If you can clarify that or not. I'd like to know why we decided on that one. And what would happen to our bus schedules if we were to do every other seat, which I believe is the 6 feet distance. This is all for Jeff, Mr. Plattenberg. Will masks be distributed by bus drivers? Overall, do we have a sufficient mask count if we have to distribute masks every day to the kids on the bus? Will the buses have plexiglass shields in between them, as I've seen in some other places? And then this is when you get into the classroom, still for Mr. Plattenberg, will teachers be expected to sanitize high-touch surface areas? So if most questions could be answered, and then if I have time for a few comments. Thank you.
Okay, well, as in the presentation that Sloan gave, when we got to the slides that actually spoke to the transportation piece, Ms. Derenak Kofax, the comment was that every other seat was something that if we were to go to that, which would provide, I believe it provides more social distancing. I don't know that it provides exactly 6 feet. Then that would have resulted in an increased bell schedule that really would result in elementary schools going till approximately after 6 p.m., closer to 6:40. I think Dr. Brabrand mentioned that in his presentation at the beginning of his introduction. And so what we talked about was to the greatest extent possible and wherever possible to provide that social distancing. Regarding the mask, I'm going to go ahead and let Mr. Smith speak to that. Regarding the actual partitions, no, when we went ahead and looked at plastic partitioning around the bus drivers, I think Dr. Brabrand had spoken to that, alluded a little bit to it. But when we checked with VDOE, we couldn't get approval for that because they checked with the feds and there was too much of a concern about obstruction around the drivers. The plexiglass between the individual seats, we didn't get concurrence on that as well because some of the situations associated with glare and the refraction and projections should they not be installed correctly because those aren't something that's normally found in a school bus. So So there was a note of that as well, and that's why we ended up going with the face shields with the individual glare. Regarding, I think I got, how many? I got 4 out of the 6. I'm going to let Mr. Smith speak to the mask count and the supplies associated with that, students.
Sure. With regard to the masks, we will be providing masks for those students who do not have their own masks. And then with regard to the daily bus rides, we would expect students to have their own masks or wear the masks either that they're providing or that we would provide. And for those that might forget their mask or not have them available, we would have disposable masks available on the bus for those students to wear while on the bus. So again, we would have masks for students and would have disposable masks available for those students who would not have theirs when they got on the bus.
One thing, Ms. Dernak-Kofax, big nugget. The state has the guideline of 6 foot on buses and proposed every other one. The state superintendent said that if that is your only variance, not to submit a variance for transportation, if your only variance is to go from every other seat to every seat. Some school districts, some school districts are moving to every seat, but requiring the mask as the additional mitigation measure. And the reality is that's my recommendation. Even with that, we're having to move elementary schedules for some elementary schools to 10:05. If we go to every other seat, you're going to go later than 10:05 and you're going to get kids home around 6 or 7 p.m. And I think, again, on this one, with the mask requirement, we're getting a good balance between safety and transportation needs.
Okay. I do have concerns with that, but thank you. The last question, Mr. Plattenberg, was will teachers have to be expected to sanitize high-touch areas?
Oh, no, in the individual classrooms, one of the things we took a look at was the high-touch areas, the doorknobs and so forth. We had taken a look to make sure that our custodians could provide that during the day and increase monitoring of the actual bathroom facilities. One of the things that I've said in my action teams, and we spoke about at length, and in fact, I talked with some of the local conversations with surrounding jurisdictions, also the National Superintendent Forums, and some of my international overseas contacts, so globally. We're trying to figure out exactly, we're all in this together. So the bottom line is everybody's going to be cleaning, and we have to make sure that people have access to things, not only to make sure that they feel safe and comfortable, but also to provide cleaning supplies for them as well. But the individual cleaning during the day, that's something we have to flesh out a little bit further within the actual classrooms. But the actual high-touch areas, the doorknobs, the handles, and the bathroom areas would be done by the custodians. And in the evenings, we'd be having the deep cleaning by the regular custodial staff that would be coming in the evenings.
Okay, thank you. And just some comments then. I do want to add my concerns about those who don't qualify under the terms of high risk or high risk of severe illness. I want us to opt for a model of a caring culture, and one that if you don't fit into the box of whatever high risk severe illness is, that you have some opportunities to opt out to a virtual model, because this virus is one that's life altering and life threatening. So thank you.
Thank you. Thank you, Fairfax. That was almost perfectly timing, so I'm very impressed with that. Ms. Corbett-Sanders is next, but I see that she's having some issues, so I'm going to go ahead and go on to Dr. Anderson and then come back to Ms. Corbett-Sanders when she's able to reconnect. So Dr. Anderson, if you're ready.
Okay, I am ready, just trying to turn this on. Going back to Mr. Plattenberg, just wanted to talk a little bit more regarding the 50% or the 25%. I am very concerned with some of our schools who are overcrowded, and I'm speaking specifically to Glen Forest in our area and Glasgow, with 1,100 and almost 2,000 kids at a middle school for Glasgow. I'm worried that at that capacity, it looks very different from another school in our area, Beech Tree, with just under 400 kids. How are we going to mitigate that if that is the option that is supported? Mr. Plattenberg?
Well, we believe, I mean, they're all very good questions, by the way. We believe that we'll be able to mitigate that because of the 50% or the 20, certainly the 25% mitigates it. You know, it's a variable division really, but in a math equation, when you're looking at metrics. But when you're looking at actual students within a middle school, Glasgow Middle School, like you mentioned, and you take half of that student body, we feel that the school will be able to accommodate it. That's again, one of the reasons why I'd gone ahead and said that when we actually work with individual principals, that they would be able to work with us to identify the actual programming that they have within their facility. And that's one of the reasons why the cafeteria would be one of those spaces that we would look at, and perhaps a media center or whatever in the ancillary spaces within and throughout the school, how we would actually be able to use them. Again, we feel confident that we'll be able to accommodate that, but it will take the granular level of the heavy lift of our principals working with us on their individual programs within their schools to identify exactly what it's going to end up looking like.
Thank you for that. One of the things that I'm hoping is not a result of this is that we continue to increase our equity issues, because if one school is able to provide at 50% kids are attending twice a week, I would not want for other schools to have less service because we're trying to accommodate a smaller group of students. So I would look that we're super creative in terms of making sure that we're providing that consistent service across the county. The other thing that I want to be able to share is I'm concerned because I know we have a lot to do regarding planning. Schools need to know how to act, what to plan for. 2 points that I want to make. One, I think it's really essential that we do have that information from teachers as soon as possible to help with that planning. And it's an issue of chicken or the egg, which is first here. So I want to be sure that we have that information, because it would be really horrible to have kids and no staff. I won't be able to make my next point. Thank you.
Thank you,
Dr. Anderson. All right, do we have any questions need to be answered on that? I think we, if not, I'm going to go back. I see Ms. Corbett Sanders has rejoined us. So Ms. Corbett Sanders, if you want to take your minute and a half, that would be great. We went ahead while you're having trouble reconnecting to us.
Sure, thank you. And I'm actually glad to follow Dr. Anderson. I ran the numbers. There's 75 of our buildings that have over 95% capacity. And I just want to kind of give everybody the metric. Dr. Brabrand said 18 inches is what we typically plan for now to determine capacity. 6 feet, so that's 25%. So 4 times. So for us, for a school that is 100% today, that means that to honor the 6 feet, it's 25%. And I agree with Dr. Anderson that we have to have a fidelity of implementation, that we either do 25% across the county or we do 50% across the county. But what we could do to alleviate that overcrowding is to provide a hybrid that allows for pure virtual play, because that may actually, if we could get an indication by our parents and families that they want a pure virtual play, and we have that deadline of July 10th, and that should facilitate or make easier the master scheduling. I do have a couple of questions regarding the health issues, and they are to do with ventilation systems. And I would like to know from Dr. Gloria if there's any concerns about the difference in the quality of our ventilation systems, because we know that that's a major concern on passing COVID for those schools that are heavily dependent on trailers for their capacity versus a new build or a renovated. And so if I could have a bit of discussion on the ventilation, that would be great. And then with Mr. Plattenberg, I would love to know more about whether or not we are offering incentives for alternative means of transportation, so that we can offset some of the demand for our buses, such as incentives for kids who ride bikes, who carpool, who walk, and whether or not we might need to change our distances for walking to school. So those are my few. And then I do have a question on social emotional, but I don't think I have the time for it.
Yeah, unfortunately, your time was up, Ms. Corbett Sanders. Those are great questions.
Can they get answered?
Mr. Plattenberg?
I thought you had a health department one first, didn't you?
I do. It's about ventilation.
Yeah, but the one regarding I'm sorry, Dr. Gloria.
I'm sorry for that. A second, I apologize. Go ahead.
So in terms of the ventilation, I think you're speaking to a possible route of transmission. Unlike tuberculosis, COVID is not transmitted airborne. It is through droplets that typically fall within 6 feet, and that's why that 6 feet distancing is very important. They're through droplets that come out of our mouth when we cough and we sneeze and so on, and they typically fall within 6 feet of coming out of a person's mouth. And so we don't have to be concerned in terms of, airborne transmission where it stays in the air for a significant amount of time and can travel to far areas from where a person is actually standing. Obviously, improved ventilation is actually helps with decreasing the transmission. Sunlight also helps, but the issue of ventilation is not about airborne mess, but rather about just improving the air circulation within a room.
But it's part of the CDC guidelines.
For improved, it's not a requirement. It is a recommendation that increased or improved ventilation actually helps with transmission.
Yeah, so thank you, Dr. Gloria. And I'll just add the other piece that you had asked for, Ms. Corporate Sanders, was really about the ventilation that we provide. We do have a robust cleaning and our filters are replaced on a regular basis, and we have evening crews that actually do that. And it's a regimen that we feel is pretty adequate with everything we've taken. It's more than adequate, actually. We've taken a look at everything that's published on this, and we've discussed this matter at length. And regarding the transportation piece, when you talk about incentivizing folks to walk or encouraging them, I do know, I haven't spoken to her directly, but the Safe Routes to Schools liaison, the coordinator for that, has been really ramping up, trying to work with folks to see if she can go ahead and encourage more people to walk. And I haven't taken a look at increasing the walking zones. And that is something that we could take a look at if interested. We did, when we took a look at our models, with our transportation models, we did anticipate the clash that we currently have with our kiss and rides and our bus drop-offs and the social distancing. And some of the time allotted in that is what we believe that we will be anticipating that we'll be experiencing as we have with any start of any new school year. It's, as you all know, it's a pretty hectic time of the year, and it usually takes till around October before the regular routes in a regular year with all of our drivers, with all of our students, gets ironed out. So we have taken that into account as well. But no, as far as incentivizing, I'm not really creative enough to figure out ways to get families to go ahead and encourage that, other than working with the Safe Routes to Schools coordinator. She does a magnificent job.
Thank you very much, Mr. Plattenberg. One other, I think next I had Ms. Cohen on our list.
Can you put me on go back then? Because I didn't get one of my questions answered, but that's okay.
Yeah, that's fine.
To that end, that's one of the big reasons I think why we continue to push the idea of an option for everybody if they want to go online. Is there are so many families that have reached out to me and said, hey, we telecommute, we have childcare built in our house. We are happy to be the ones to take it online because our kids are doing fine learning that way, and we want to leave those seats open for kids who either may not have those childcare options or are having difficult accessing learning online. The other piece of that to me would be a transportation survey that comes out from our principals to our parents asking that same question. Are you able, are you willing to drive your child to school, commit for the first semester? Can you do it? There are many of us who would carpool in our minivans, to make sure that we're able to get our kids there. And again, hopefully free up buses from schools where there's a very small footprint and allow you to have more flexibility with buses in places where people don't have that option. So I would really like to see that. One big concern that I had is in the 50 to 25% model. I just want to be sure that I'm clear. We're not asking our teachers to teach every day in person and then to also be teaching the other 50% of kids online as well. Is that, I just want to be totally clear with that.
That's correct. At the same time, there's one small piece at elementary that we're still thinking about, whether at elementary for the morning meeting, the first 20 minutes in elementary. Some school districts are talking about this. Do the check-in for the morning meeting, and then they would do asynchronous instruction, those kids that are not, say, on the 50% schedule, or even on the 25%, that they check in for that 20 or 30 minutes, and then they're done for the day to do other independent directed activities. So that's something we're still looking at. Some of our principals think that's an interesting idea that keeps the social emotional connections going. And we're talking about that with some school districts.
Wait, but may I clarify? I mean, teachers are not expected to develop lesson plans for in-person and also be developing online content for the kids who are in their B block.
Not at the same time, and Sloan can tell you how we're approaching doing a curriculum each week, and he could speak to that a little bit, but not at the same time where the kids are in and you're trying to teach kids in the class and give them work for those kids that are at home.
I think no, I'm not talking about at the same time. I'm talking about our staff members supposed to be developing that, like, are we essentially asking them to be teaching?
Sorry, Jen, I think what she's trying to say is who's responsible for the developing the curriculum for the asynchronous days? Is it the same teacher doing the synchronous days? That's what.
Yeah, Sloan, can you help answer that?
Yeah, absolutely. It's a good question. It's something we might want to talk about in more detail too in upcoming discussions. But essentially, what we're trying to do is minimize the amount of planning time that teachers have to do. So the first thing that we're trying to do centrally to do that is to rewrite our planning and pacing guides and basically reorganize them in ways where we're developing units, lessons, and assessments teams and teachers can already begin to use and work from. And customized to meet their own needs. But the idea with the 50% or the 25% model is to provide that type of curriculum package in a way that teachers don't try to teach the same lesson to group A on Monday and group B on Tuesday and then develop another lesson for when the kids are off. It's that you're developing the curriculum for the unit, for the week, or for several weeks. And really what you're doing is when the students are in class with you, you're spending more time working individually with groups and working with individual students on the learning so that you're not doing double planning. So we're trying to prevent exactly what you're saying of having to have teachers do double planning. The other thing that we're doing, and you saw it in the budget slide, is trying to adopt new instructional materials that really are more student directed and what we would say is basically adjust based on student learning need. So that's going to be for math and for literacy so that those materials will be available and be accessible and be more self-directed and can be used on asynchronous days when the students are home, and to try to alleviate some of that pressure that a lot of our parents have felt of, really having to be the teacher in their home and help their students, to a large degree with some of the, materials and resources that we developed for this spring. So those are two of the big things that we're working on.
So my apologies, just to be, again, crystal clear, I just want to clarify, you're not saying, teachers are not having to plan for two separate blocks, because what you're saying is the 2 days you're in class will be live instruction, the other 2 days will be asynchronous. Is that what you're saying?
That's what we're recommending. And that's how we're trying to design our curriculum resources, is to support that, because again, that eliminates the double planning that you're talking about. So that is our recommendation.
Okay, I did not think that was clear, just as an FYI. So
Well,
thanks for that.
I'm sure it wasn't. I was trying to run through 57 slides really quickly. So
Thank you, Ms. No, that's fair. That's fair. You can just imagine that's a huge concern for our staff. I just wanted us to be totally clear on that.
absolutely. And just so you know, we've been working with classroom teachers for weeks on this, right? And really trying to understand what's going to work best. And obviously, classroom teachers help us with the curriculum writing during the summer. So it's not just central office folks developing things. It's really us working with folks that, you know, are going to be teaching the materials in the fall. So.
Thank you very much. I'm going to go ahead and move on to Ms. Keys-Gamarra, please.
Will you add me to a go back, Ms. Sizemore-Heiser?
Sure.
Thank you. I have 4 things I'd like to get clarification on. I'll move as quickly as I can. With respect to the technical question I asked earlier, I really am asking who is the person responsible for structuring this part of our program, and who do we direct questions to? I understand that we have a team approach, but I am concerned about relying upon providers such as Blackboard or whomever. I'm not making a disparaging remark regarding them, but we do need to make sure that we have someone there who is knowledgeable and is helping to make decisions in our best interest. That's number 1. So I'd like for that to be a next step as to how we are addressing that. Number 2, I previously mentioned that I'd like to explore this as a community issue, looking through the lens of One Fairfax. I do not understand how, if we are doing 25% or 50% of our population, that there won't be some kids who are left out. And so I would like to make sure that we are looking at that as a real option, or at least come back to the board as to what can possibly work. Number 3, with respect to masks, I received I think it was Ms. Pekarsky and myself, heard a question with respect to students who receive special education, who require touch, who require, it's going to be impossible.
Thank you. Finish your thought, please,
Gamarra. Finish my sentence? Okay. I try to be respectful. It's going to be impossible to respect that 6 feet. So that means, especially for young people, that there's some work we may have to do, because kids get afraid when they see the whole get up, like the firemen or, you know, their mask and all of that. And this particular population could become afraid. I do have one other question, but I'll do it as a go back.
So a couple of things. The technology we'll do as a next step. I hear what you're saying, and we'll work on that part as a next step. You're totally right that in some of these special education classes, the whole get up and gear and how to not make kids be afraid, but to have our teachers feel secure as we interact with these kids less than 6 feet. You totally nailed that. I agree. And we can come back and share a little bit more about that. But we are ordering gowns, face shields, gloves. That would be part of what we would do. I may have left my train of thought on one of your other questions that you asked.
Making sure we look at community properties and other spaces to make sure we don't leave students out.
Yeah, and all the students out too, the 25 and 50%, Ms. Keys-Gamarra, has the Friday intervention to have kids come back for either a second dip in the 25% or a third day or third dip in the 50%. And we would target EL kids, special education kids to come back for another day that Friday morning in both models.
I'm leaving that as a next step. Thank you.
Okay.
Thank you, Ms. Keys-Gamarra. Next, we have Ms. Marin. Oh, I'm sorry, Ms. Marin did not want to go back. I apologize. So Ms. Tolan.
Oh, no, I do. I have
Oh, you told yourself I think you didn't. So I apologize. Ms. Marin.
Okay, thank you. No, I have my hand up. Yeah, so just 3 things. One is that, you know, when I spoke earlier and others have spoken about the option 3, that parents want the option to have their children learn at home if they feel that it's safe, not just based on medical need. I also want to expand that to staff having that option, and I'm pretty sure my colleagues will agree with that. So, you know, we've been talking about students' options to opt out of in-school learning And I just want to be sure that staff have that. I believe you talked about that, Dr. Presidio, at the town hall, and perhaps matching staff up with students who are opting to stay home for whatever reason. So I just wanted to clarify that. I'm glad to hear the clarification that Ms. Cohen raised, because as I said, when we were in the first phase back in the spring, or just in that place, that we cannot expect teachers to do both the synchronous and asynchronous. And so I just want to echo that. And then finally, I support what Ms. Tolan said about getting creative about outdoor space. We had actually both attended a national webinar about how schools are trying to use that space creatively. And while it's daunting to think what we can do in the seasons and all of that, these kind of creative strategies, perhaps schools can be given some, leeway to do that, or the district can do it. But anyway, just wanted to share those points.
If I could on one thing, and Dr. Ivy or Dr. Presidio, help me if you think I need help, but I want to say something here, just transparency, because I know one of the things the board has told me, be transparent and be a straight shooter. You want option 3 to become ultimate choice for everybody, you have to think through the overpromise, underdeliver. If every teacher prefers virtual, 90%, but only 30% of the teachers, the students want virtual, you can't run school in August. And I just need to be very candid with all of you that I'd love to do it. I thought about it. I debated it with staff, but I'm not going to go through what I went through 2 or 3 months ago to promise the community something I can't deliver. And if those numbers don't match up, we're not school face-to-face in August. So we have to really think through and talk about that. If we feel that strongly about it, that then I think what we're really saying is we need to just do virtual for everybody. And that's just me being real with you about how to balance those percentages. If they don't balance out, we've got a major operational problem.
Yeah, no, I think it's fair to say what's not achievable, and I support that. The reality is, we will have staff that would feel that might medically be fine to go in, but don't feel safe. So
correct.
Those students, where do those staff fit into the scenario? So yeah.
I'll take your feedback back and think about how I can approach that idea that you're looking at, but I'm also just telling you the operational challenge of if it's a guarantee and the percentages don't match, we're back to where we were in the spring, and I don't want to be there.
Thank you, Ms. Marin. I apologize, Ms. McLaughlin. I called Ms. Marin ahead of you, so that's my fault. So Ms. McLaughlin? Ms. McLaughlin, are you there?
Yes, sorry about that. So I appreciate following just now what this conversation was. Dr. Brabrand, you and I and this whole board are very sensitive that teaching is one of those professions that is a front-facing profession. And we absolutely have to do everything we can to create safe learning environments and safe working conditions. But this is why all of this work has got to be built around the science and the public health and safety guidelines. We cannot, as leaders, be talking about what we individually, the 12 of us or you, what our feelings are, and we have to help address when we have employees where how they're feeling about a 100-year-old, never seen before pandemic. What do we do with that? And that's why my early remarks were, what are the other school divisions doing? I think that there's going to need to be greater conversation about this, but part of my struggle with today's work session is we had problems with our distance learning. It's been talked about today. We've had problems with how we delivered on our graduation ceremonies. I'm just going to emphasize that here and now. This school division has got to be nimble and flexible, using the science to build out its programs. The other universities have been talking with each other. They've been using each other's brain trust to sort this out. And right now, today's conversation, I'm not hearing that other school divisions are going to have their teachers walk out on them, that they will have no one to teach the children. But I do worry about the fact that our working families, their offices are reopening. Those parents where they can't telework are going to have to go to work, and we've got to figure out what to do for kids. Yes.
Thank you.
Thank you. Dr. Raybrand, do you want to respond to that? Or I think it was more sort of commentary, but I do think a next step of bringing back what other systems are doing would be very valuable for the next work session.
Yeah, and all I'd say is, I mean, with respect to all of my colleagues, we're one of the first districts coming out with this much detail. So some of it is the districts are still trying to figure it out. And I do agree, Ms. McLaughlin, about the science having a role. Look, we want to be safe and we want to use the data to inform our decisions. I'm just saying it this simply. If it's completely optional about who comes back to work and who doesn't, you're not going to have a match. You would be very lucky to have a match between the students and families who want their kids to come back to school face-to-face and the percentage of staff that would opt out and prefer to be at home. And I am not going to, with all due respect, I am not going to make a promise to the public or the school board that I know, as I logically think through this, sets us up not to be successful. And I worry on this one that that model does so. I love to please, but I'm growing as a leader, and I'm going to give you the facts that if the match doesn't happen between kids who opt out and teachers, we have a massive problem in delivering the instruction. And that's just the truth.
Great. Thank you very much, Dr. Braybrand. Ms. Tolan?
Yes, hi. My comments kind of follow naturally with this. I am really hoping, I'd like to hear a little bit more about how we're approaching this regionally. I know transportation-wise, et cetera, we've conferred with neighboring counties, but in the bigger picture, with so many of our staff and families that, staff that live in Loudoun, work in Fairfax, live in Arlington, work in Fairfax, et cetera, and families that work in these areas, I would like to know that we are looking regionally and trying to do something together with other school districts. Also, around the data for teachers, for schools, for students, I'm hearing from my community some distress with the survey that was recently sent out. So I hope we have some ways that we're thinking about it, additionally looking at this data as to what families are comfortable with and what teachers will be doing, so that we can be accurate in moving forward, like just for the balance, like you're talking about, Dr. Braybrand. Also, a question for the health department folks. The 25% and the 50% scenario assume that we will be in phase 3 at the beginning of the school year, for example. If we start the school year, and I'm just as a hypothetical, in phase 3, how, what will the criteria be to move into phase 4, or how we can move forward, or what is our criteria to back to phase 2? I think we need to be clear about that up front.
Thank you, Ms. Tolan. So, Dr. Gloria, if you want to start with the last question first, perhaps.
So, in terms of metrics for either moving to the next phase or coming back to a phase that we previously left, that has not been provided at this time, and it's something that probably will come from the state. So I will defer on that. There are metrics out there that have been, if you read through the literature, that have been suggested, but the state has to adopt whatever metrics they see fit. So if you don't mind, I will just defer on that one.
Great. Dr. Braybrand, do you want to address any of
Ms. Tolan, we'll get you updates. I think several board members want to know how we're collaborating. I've been meeting with the regions for 6 straight weeks, every week. I've large county school districts every week for 6 straight weeks. So we'll get you a summary. The truth is, we're ahead. They're asking me to slow down. This board doesn't want to slow down. This community wants answers, and I'm trying to get them. But on this one, where what's everybody else doing? Everybody else is looking at what Fairfax is doing, to be honest. And we're trying to listen and talk with other folks in other districts. But a lot of the truth is, this is the hardest, this fall is the hardest year for any school leader, superintendent, principal, or teacher in the history of public education. I absolutely believe it. And come up with answers that are very, very, very complicated. So I will definitely give you guys, though, a full summary of our regional and national collaborations for next week's work session.
Thank you very much. Mr. Frisch?
Thank you. So I guess the thing that's most clear today, or clearest today, it's what's been clear for the last few weeks while those of us on the board have been hearing from parents and staff and teachers and everyone, is that there's no perfect answer to any of this. Give me an idea and I will find a problem with it. Guaranteed. And every idea is presented as if it's perfect. Not saying that the ideas today are being presented as perfect, but that's how the ownership feels around these ideas, right? We work hard, we think of something, and then somebody turns it into Swiss cheese because there is no perfect opportunity here. That's why I think it is so important that we look at what we're planning and we conceive of every possible problem or circumstance that could arise. So when I think about the changed bell schedule, for example, what are we going to do about elementary kids standing outside of schools or walking home in the middle of what feels like the middle of the night because it's dark out? You know, when I think about the screenings, are bus drivers going to be involved in that? Because we're mixing a lot of kids in the buses that are not mixing in the schools necessarily. How's that going to work out? You know, the issue of whether, you know, and how students or teachers, you know, I am in a risk category. I've had asthma since I was a little kid, and I know the buzzer just went off. But here's my final question. If a teacher or a staff member is not falling personally into a risk category, to what extent are there, you know, opportunities for them to bow out because they have a spouse or a loved one in the home or somebody that they're frequently in contact with? These are the types of one off to another off to another offs that we have to think through before we pull the trigger.
Thank you. Yes, I appreciate that.
I completely agree. If I took a takeaway today to tell the community, there's no perfect solution, there's no perfect answer. We're in an imperfect moment in our history, and we've got to figure out what the best of can be. The best of for safety, the best of for instruction. And what I feel good about is that we will, I mean, in Fairfax, like no other, we will have thought about it. Staff is pouring over 24 hours a day, nights, weekends, thinking of every angle. And then you guys bring more angles, the community. We already hear that the public hearing numbers for this are over 250 people who want to come out. So we're going to have it from 8 ways to Sunday. But at the end, we got to pick a path and know that whatever path it is an imperfect path. If you're going to grade me or the team on 100, we're going to come up with an F grade because there's just not an easy A in this work. Mr. Frisch has nailed it. I totally agree with that. There will not be an easy A, or maybe not even an A at all. We're going to need to do our best work, hopefully honors work, but I can't say that it's going to be A+ work in the sense that every member of the community will feel this is the right plan. That's the elusive piece of this whole discussion.
Great. Thank you very much, Dr. Brabrand. Ms. Onesh?
Thank you. So in trying to make sure it's as successful as we can get, I have a couple of questions I want to prioritize for our health officials, and then I'll finish my list from earlier. So one of the questions is the shortages of materials. I touched on this earlier, but whether it's PPE, sanitizers, wipes, I'm curious from y'all's side, wholesale type of scaling, what you have seen. And this is maybe, Jeff, if you want to jump in here, or even Marty from an operations perspective, especially keeping in mind, if kids are not going to bring certain things, are we going to be providing that once they arrive? The second question I have from a health perspective, Dr. Gloria, if you can comment on the mental health implications of all our possibilities, actually, whether we open and the anxiety around that, whether we don't, and the tech exposure and challenges with that. And then thirdly, I'd like your take on the athletics piece of this. It's kind of gross, but I mean, I imagine, sweat and just a lot of contact that may be intuitively, I'm thinking more riskier. I'd love to hear your take from a health perspective. In addition to your understanding maybe of the benefits to nurses and other school staff that can be supportive of that, which I know is something that we had as a follow-on motion from our previous budget conversation. And finally, I'll direct this and then I'll pause. In terms of the identification of these families who may be vulnerable or who may want to opt out, I'm curious to hear your idea as to what metrics or procedures would make sense to move forward with that. And then, for our own FCPS staff, I think there's an important piece for us to consider that we're planning to have a decision near the end of the month, but we're requiring these families to opt into this virtual program by the 10th of July. So that's just for our sake. Is that my time? All right, I need another go back for the other. Thank you. All right.
Dr. Brabrand, do you want to comment? Otherwise, I'll go on to Ms. Pekarsky.
And Dr. Gloria.
I would say on the last piece, we're asking staff by the end of June, and then we'll be asking parents by July 10th. So we're asking staff before we're asking the kids, which I think is the right order.
Dr. Gloria, sorry. Dr.
Oh, so that's not a deadline. Okay, that was the point of clarification then. Mm-hmm. Right? It's our deadline internally.
Yeah, it's our deadline. It's an internal deadline.
And then Dr. Gloria, if you want to answer, if you have some information from Ms. Omace, that would be helpful on the first part.
So the issue of, I think the first question you asked had to do with PPE availability. That remains a challenge on many fronts, even for us as a health department. Our priority has been to provide as we can to long-term care facilities where we know we've had a lot of illness and deaths, and also to our medical providers. So we have on a couple of occasions provided it to the Medical Society and the Dental Society to provide to our healthcare providers for whom not having an N95 respirator or other PPE precludes them, especially the private doctors, from actually performing tests because they don't feel safe. So that's how we have used our cache of PPE, the very little that we have. Office of Emergency Management is the vehicle through which all county supplies have been, or requests for supplies have been made through. I'm not sure how FCPS has done their purchasing of PPE and other supplies, and whether you all work with the Office of Emergency Management or not. So maybe Dr. Brabrand can answer that. In regards to metrics, again, I'd prefer not to comment on that because, the reopening metrics came from the governor's office. So he has an advisory team that works with him together with the Virginia Department of Health. And I know these are things that they are looking at. So I think it would be out of place for me to be commenting on metrics that I have no idea
If I could kindly just clarify the metrics not necessarily being about opening or not, but about identification of vulnerable families, right? Because are we just going to let anyone opt out, or are we going to have criteria internally for what's viable for that?
Okay, so
Sorry.
So I don't think that the guidance, and I haven't finished reading the entire document, so Dr. Brabrand can speak to that. I don't think that the Department of Education guidance that you all received had any criteria for identifying people who are considered vulnerable. I think this is about people knowing their situations, their living situations, their own medical situations, and that of their loved ones, and making the decision as to whether they are putting themselves at risk or putting their loved ones at risk by, mingling with others in the work setting or in other settings. So, I mean, even as we have progressed from one phase to another, and looking at the reopening, I believe the governor's comment that he made was that it is still safer at home. And from the presentation that Dr. Schwartz and I made, I think one of the things I said was that we've seen a decrease in number of cases as a result of the physical distancing measures. However, the virus hasn't gone away. The virus remains. And so as we open up and we can go out and do more than we've been permitted to do previously, it's not the same. It's not a one size fit all. I mean, it's not a one size fit for everyone. And the fact that we can doesn't mean that we should, because for some, it would be putting themselves at risk as well as putting their loved ones at risk who live in the same household with them.
All right, thank you very much, Ms. Umesh. I appreciate that. Ms. Pekarsky?
I didn't get answers to other questions. I mean, I don't know. The mental health question and the athletics questions. Yeah, but.
Sorry, I didn't finish my question. So in terms of mental health, I mean, I think the events of the last 6 months have been unprecedented and created a lot of, especially because, number one, this has never happened before, the rapidity with which the virus has basically encircled the globe, the fact that schools closed and basically everything came to a standstill very quickly without much warning. And then we were in the shelter in place mode for at least 2 months, 2.5 months. I think it's taken a toll on many people, especially on people who may already be predisposed with mental health issues, anxiety, depression, and so on and so forth. And so that is the other pandemic that is emerging as a result of this, as a result of this virus and the measures that we are taking to limit the spread of disease. So I'm sure that as school comes back online, that you'll have your students, maybe even staff, for whom the past few months may have taken an extra toll on, that will have to be, addressed through the counseling and the other resources that are available through the schools, through the CSB and the community. Please tell me the last question.
The last one's about athletics, which I believe was from Mr. Smith, perhaps, or one of our school staff to respond to, I believe. Or maybe Mr. Presidio.
It's also a health question, though, I think, right? So whether there are heightened precautions or not. But
yeah, I mean, we're getting a little bit from return to play. Ms. O'Malley, the VHSL is coming out with something in about a week for we think in about a week or so about guidance for all of the sports. I think some sports are going to be easier to do, even with sweat, because it's really going to be back about 6-foot contact, like golf, cross country. May be a very different sport to be able to do than, say, football or wrestling. So VHSL, the Virginia High School League, is doing a lot of work right now, and when we have it, we'll bring it back. We only had one slide for you today, but when we have more, we'll bring back more to go over that, because that's going to be a lot of community questions around that topic as well.
If I can interject just quickly right before I take my turn, I'd like to do a time check for everybody. It is now 6 o'clock. We're an hour and a half over our end time. We are going to have another work session. We are going to have our public comment. I would ask that my colleagues consider saving go backs and emailing or for the next work session. But of course, I will let that be a board decision. But I do suggest we take that route if that counts for anything. And Ms. Sizemore-Heiser, if you want to start.
Yes, I was just at the timer, and I agree with you, Mr. Pekarsky. I think if we can keep our go backs to the next round and or emails, I think that would be good since we're so far behind. Go ahead, Ms. Pekarsky.
I appreciate what Mr. Frisch said. Again, there are difficulties. There is no perfect plan right now. I think if we are focused on our two overarching, goals, keep teachers and students and staff safe and get kids as much in the school instruction as possible is our goal at the end of the day. Having said that, Dr. Brabrand, as I shared with you before, I'm very interested in considering possible calendar changes. And I know that's difficult for the community. I want to hear from the community, but I think it's a time where we need to be nimble and looking at, what is our overarching goal? Getting kids face-to-face instruction. So I just wanted to share that with my colleagues.
Okay.
I am also concerned and wondering, the school closures, what will be, I guess, who will be in charge or who will be paying attention to what happens if we're shifting between phases? What do we do? Who says, okay, this is it? Is the health department going to say, hey, FCPS, you need to consider going back? What does that look like practically?
So I'll say that we worked very carefully with the health department, and I think Dr. Gloria would like me to do everything I can to follow her good counsel about opening and closing school, and I've maybe had a mixed record on that, just being honest. If we're going to just put it all out there. So one of the things Dr. Gloria and I talked about last week, and she was just being real and honest with me, is we will put a bumper sticker on this about when to close school. The answer is it depends. That's what Dr. Gloria said to me. It depends the conditions. It depends what the contact tracer discovered. Did it happen at the school? Was the kid at the school for a minute or the whole day? Who did they interact with? So we have to really watch saying if it's X, it's going to be Y. And that's why it's such a hard issue from a public policy standpoint, because the community wants it simple. And we want to make it as simple as it can be, but being true to the health experts and the data. Dr. Gloria, have I said that decently? Or do you want to add?
Yes, certainly you have. And if you recall, when we talked a few weeks ago, I gave you the example of Lee High School, which the TB incident at Lee High School a few years back. So if you all know, tuberculosis isn't anything new that we experienced in Fairfax County. Every year we have, 60, 70 cases. And we do have TB in schools sometimes. And we do contact investigations. And sometimes the contact investigations are very limited to a few people sitting very close to a student. And sometimes it's maybe a little bit larger, but within the classroom. never in the 20 years that I've been here have we had the TB investigation that required that we actually test the entire school. And that happened a few years ago at Lee High School. Why? Because the investigation led us there. So that's what contact investigations do. You kind of build a smaller ring around the case, and if, as you do your investigation, it seems as if there's more exposure and more transmission, you kind of widen that circle until it takes you to a place where you get to, until you get to a place where it just makes sense to either shut everything down or just a class or whatever. It's these hypotheticals that we can't get in ahead of time. I think that we do have a good contact tracing team. This is something we do all the time, and we keep going until we stop. And so wherever that lends us is exactly what we do.
Thank you. We appreciate your good counsel, your expert counsel in making these decisions. My last point will be about, okay, 5 seconds quickly. I don't want wearing masks, keeping social distancing to become another issue where we are dealing with behaviors, we are punishing kids. I am very weary of that, and I just want to put that out there. And how will we, what can we expect of our students if parents say, my kids will not do this? How do we deal with that?
No, that's a great follow-up next step question. Let me do that for the next meeting. I totally get your point there. You know, Karen Keys-Gamara talked about kids being scared to see some teachers that might be in PPE. Then this is about kids struggling. I have to tell you, I wear a mask, and after an hour at Gatehouse, I get frustrated having the mask. My ears hurt. I want to pull it off my mouth. So we've got to figure out how we're not going to turn this into something to punish kids about. Absolutely, while also admitting how important it is for kids to do it so that they're safe. So that's going to be what we have to figure out. I'll work on that for a next step, Ms. Pekarsky.
Thank you.
Great. I will take my last one, Stella, Ms. Pekarsky, if you can time me. I also want to start by saying that I've been saying for a while, and it's what Mr. Fish said, we are having to pick what we think is the best of bad options with limited information. So I just wanted to put it out there that I know everyone's doing their best to figure out the best of bad options and being nimble. I would like to encourage us that we be bold in looking at reimagining education, for example, looking at region and pyramid planning with staffing. So if we are having staffing challenges with those who are at high risk teaching virtually, can we be more creative across buildings and looking at staffing, especially for secondary education where we have endorsement issues. Same with the fidelity of implementation, consistency, if we are virtual, to make sure that we're being consistent across our schools and everyone's getting an equitable experience. I would also like to make sure that we are looking at our co-curricular and our arts programming to make sure we can figure out how to do those safely in the building, as well as expanded options for doing those virtually. And then I would also look at creative scheduling for our families to make the childcare issues as less as possible. So for example, if we're doing a 25% or 50% scenario, can we keep families in this with children together in those groupings, and recognizing that could be difficult when you have families maybe at 3 or 4 schools, but as much as we can, as well as pacing guides and supports for families. Stella, is my time up?
You've got 5 seconds.
And then same with teacher workload. I really think in that reimagining education, what you talked about, making sure it's clear to our teachers how we're going to help support them in this sort of half environment, as well as our families with pacing guides, so our families have a better way to support their children at home as well. So I think my 5 seconds are probably up. So these are really more next steps for next week. It's not the answers I'm looking for today, but I'm just doing one last thing. Stella's point about calendar changes. I think that's really important to look at as part of that reimagining education. So that's my last minute and a half. I just wanted to put out again, as Ms. Pekarsky mentioned, it's 6:08 at this point. I have written down at least 6 people who had go backs. So we could continue this, or we do have one more work session next week. I would urge my colleagues, similar to Ms. Pekarsky, to email the go back questions that we have and then continue our conversation at our work session next week. So I would just like to see if we can get some consensus around continue this conversation next week.
Are you looking for a show of hands around this,
Yeah,
Ms. Eisner-Heiser?
That's about in the conversation next week. Thank you, Dr. Anderson.
Okay.
It looks like we have consensus to continue for next week. So if you have follow-up questions, or if you feel your questions weren't fully answered, please feel free to email them to staff and or save them for next week.
Ms. Sizemore-Heiser, we do need to do our next steps. So
Yeah, I wasn't done. I wasn't talking about those pieces of it. No, I understand. I'm just talking about the next questions. Thank you, though.
Ms. Eisner-Heiser, can we also get clarification regarding the person to whom our next step, our questions should be sent? I want to prevent sending it to the whole world. Can we have a designated person to receive that information, Dr. Brabrand?
Well, normally next steps go to the clerk sends them to us, and then we work on.
No, I'm so sorry. I didn't mean next steps. I just meant questions. If we wanted to send questions ahead of time, ahead of next week.
Well, if I'm being real with you, Dr. Anderson, I'd rather it just be in a next step. That's going to be plenty on there for us to do. Next steps plus question. I'd urge the board to ask the questions that you need to make the decision. We are buried in work unlike we've ever been. So, but if it's really a burning question, I'd rather have it as the next step than just a question. Because then we're going to get, well, my next step got answered, but my question didn't. I'd rather have it all in the next step. Unless it's a small question and you just want to email that specific person. But if it's a burning question, I'd rather it be a next step.
Much appreciated. Thank you.
So if everybody could please look at your asks and decide if this is something you absolutely need to go forward. And then maybe we could vote on this as a group, if that's okay.
So oh, sorry. Go ahead, Rachna. No, it was our Jane. Sorry.
I just want to make sure that I'm aware there's a whole nother page, so.
Yeah, if we could put the next question and go in order, perhaps. Sorry, Ms. Cohen, that might be easier, but unless you have something, a process question, Ms. Cohen.
I did have a process question. I just, in looking at the Code of Virginia, the section 22.1-304, it specifically says that the school board, with approval of the superintendent, can give approval for resignations after June 15th. So I didn't know if that was something we needed to address outside of next steps. That was my question. It certainly could have waited until we got to me. I apologize.
Yeah, I think if we don't mind, let's wait till we get to you on that one. We can discuss that then, whether we need to have that there or not, if you don't mind.
Ms. Sizemore-Heiser, this is Megan McLaughlin. I'm mindful that our clerk just said this is going on to a whole nother page where these questions are. And in light of the depth of questions, and we're going into another work session, can we instead just have the clerk of the board send us a draft of our questions, board members respond back to her, clarifying if the question was captured correctly or not. They're then turned over to the superintendent for his review as they prepare for the June 23rd. And then we'll just go ahead and move on with the second work session to discuss. I just don't think it makes sense for us to wordsmith and fix each other's individual questions since we have a second work session already happening.
I would be fine with that in terms of having the clerk email them to us, and then we can fix them that way. I want to get consensus from the board if my colleagues are okay with having the clerk email what she has, having us get back to her, and then having that sent on to leadership.
Can I raise more?
I am in support of Ms. McLaughlin's idea.
If you could raise your hands for me, that would be helpful. Thank you. Looks like we have consensus. Ms. McLaughlin, Mr. Frisch. Okay, Ms. McLaughlin, Ms. Corbett Sanders, Ms. Cohen, Ms. Janet Kofax, Dr. Anderson.
No, wait, no, not Ms. Cohen. Not on mine. Not on mine. Sorry.
Okay, so let me know when.
Because we have a deadline of today. I'm sorry. That's the reason I want to be really specific about this is that we have a deadline of today. And according to the code, it is something that is actionable. So I don't want us to mess this up and then have someone come back and say, well, we were waiting for you to do something. Okay.
Ms. Cohen, I totally agree. I think it should only be all of us have questions that can wait until next week. It's not time sensitive. We just don't have to pour through those kinds of questions today.
Yeah.
All right, so let me, go ahead, Dr. Brabrand.
I actually referenced a little earlier that I got my my staff texted me this, and I shared I would be flexible working with HR. I referenced it earlier. Maybe I didn't say it well, but I will certainly work around that if the board feels it needs to take a vote about it. But I'm not sure that that's necessary. I'll defer to the board.
But what does flexible mean? I just want us to be very specific.
Ms. Ms. Mulberg, can you please put those up again so we can see? I would appreciate if people looked at their questions, and if they feel that they can pull them off and wait until next week, that would be helpful.
Ms. Pekarsky, can I ask one additional question based on what Ms. Cohen just mentioned?
Absolutely.
I would like before tomorrow, or actually it has to be done today, if somebody could get our legal counsel to indicate whether or not we need to do something formally to show support for the superintendent to exercise the flexibility that he is willing to, that he's offered to do, or do we have to have a show of hands? And unfortunately, I don't see Mr. Foster or Ms. Kennedy on this call, so we don't have that legal counsel here.
All right, Dr. Brabrand, is it possible to contact Mr. Foster and to find out whether we need to have a board vote formally for you to be able to have the flexibility that Ms. Cohen talked about?
Or alternative, we can just do a quick vote offering the flexibility, and if he needs it, he has it, and if he doesn't need it, then we just took an extra vote.
I think that is a great idea.
All right, so let's start with what Ms. Pekarsky said. If we can maybe first look at our next steps and make sure that there's nothing else that's time sensitive. And if there's nothing else time sensitive, then we can move on to having Ms. Mulberg send those to us and then review them and send them back. And then if there is something that's time sensitive, if you want to raise your hand, I know Ms. Cohen, we flagged yours, but if you could raise your hand, we can make sure we address that before we adjourn the meeting. Does that sound all right to everybody? So
let me know when you'd like to scroll through.
Just so you know, I'll be combining some of mine because they seem to be repetitive. So I'll streamline the language.
Are we ready to go to the next slide? Ms. McLaughlin and Ms. Janakobis, I see your hands are up. If you don't mind, I'll wait till we look at the next slide, then I can call on you as we go through.
Okay. Should I scroll more?
Yeah. Scroll a little more. I think we lost the sheet.
Can we go ahead and
Yeah, let's go. So Ms. Jana Colfax?
Yes, I don't see mine captured. And Dr. Brabrand said he would do it. I asked specifically about the, the daily health screenings. these self-reporting, what will these forms look like? How will they be submitted? Who will monitor them? Will students be allowed in school if these forms are not complete? Will they be allowed on the bus?
I have several that are missing also, but I will email Ms. Muhlenberg mine. Can we see if we do find that there's others that are missing? Is it possible to email those to Ms. Muhlenberg unless they're time sensitive?
Well, I think mine was time sensitive only because that's going to be extremely important that we have the answer to that at the next work session.
I'm sorry, I meant today. I would like to see if we can email Ms. Muhlenberg in the next day or so then our staff has these before our next work session. So I apologize if I wasn't clear.
Okay. Yes, of course.
Ms. Corbett-Sanders? Ms. Corbett-Sanders?
Yes, just a few things. I will be adding a next step on asking for more details on the social, emotional, and behavioral supports that we will be including as part of this plan. Secondly, I think we have to have the day programs didn't get included in there, and I'll send language on that. And then the other piece is that it would be helpful to have for next week a back to school, our back to school nights or back to school events. This year more than ever, we're going to have an intentful approach to back to school in advance of our kids re-engaging. And then the last one, to capture what Ms. McLaughlin said, a hybrid that Prince William, Loudoun, and Arlington have all announced hybrid models. So it would be helpful when we talk next week for the superintendent to be able to explain how our hybrid model compares to what is being briefed in Arlington, Loudoun, and Prince William. Oh, and then one last is, do we need to ask for funding for additional funding that the county has gotten under the CARES Act, that we might want to ask for additional funding to try to fix this shortfall?
See, I don't mean to cut you off, Ms. Corbett-Sanders. I apologize. Again, I want to go back to, all of those are great suggestions, but again, unless there's something that we need to decide on today, I would like to take a vote to see if we can email all of our suggestions, or we can go through all the next steps. But I think we voted earlier on not going through them, but emailing them to the clerk. So I wanted to make sure that we can.
But Ms. Sizemore, the reason I reference what additional is that those are things that people may not have heard before, and we want to make sure as part of our process that it's not just an individual board member sending in an email that others don't see. And so it's just making sure that everybody hears the general issues.
I will, once I've gotten them all by the end of tonight, I will email a full list out to everyone.
Thank you.
Okay. And with that, I think Ms. Chairman wanted us to take a vote for allowing for that flexibility since we don't have Mr. Foster here. So if people feel comfortable with that. Karen?
Yes, what we want to do is just have a motion made by Ms. Cohen and seconded by somebody else. Okay. And that motion should be to provide the flexibility for the superintendent to exercise flexibility in the date by which our teachers need to indicate that they will be returning. And Dr. Brabrand, do you have a specific date? Do you want to say by the 26th when we adopt this, or by what date do you need that extension?
I just want to share with you what came through. You know, sometimes when you think I'm not listening, and most of the time I am, there's emails that come through. I got the code from HR. A teacher may resign after June 15th with the approval of the local school board, or upon authorization by the school board with the approval of the division superintendent. So I think the language could just be the school board authorizes the division superintendent to approve any teacher who wishes to resign and be released from the contract without prejudice after the June 15th deadline due to special circumstances. Again, special circumstances, childcare needs, not aligning with work reporting expectations, school operating status. So, or you could just say special circumstances.
But is there then not a concern that we're not getting it to the principals? I'm trying real hard to walk a very delicate line here, which is being in support of our staff, having the full information before they make decisions. But also I know it's very important for our admins to get an accurate staff count. So at the same time, I really appreciate your flexibility. I very much do. I just want to make sure that we're also not putting you in a position where somebody, changes their mind in September and then we're changing it. So, I also understand there needs to be some timeline. We were just asking for some extension. So with all due deference.
Yeah, if you were going to do it, I would do it to June 30th, from June 15th to June 30th. That gives another work session, and we share the intent of how we're going to move forward so teachers know, and then they have 4 days from that last, actually, really, they have a week from the 23rd, our second work session, which really may be our last, and the end of the month. So June 30th is what I would offer. Authorize the division superintendent to grant special circumstances past June 15th until June 30th.
So that motion will be made by Ms. Cohen, and we need a second.
Do we have a second for that?
Ms. Pekarsky, were you saying something? I'm sorry.
Nope, I was just going to say what you did.
Okay.
I can second it.
Second by Ms. Tolan, I see. So motion made by Ms. Cohen and seconded by Ms. Tolan. All those in favor, please raise your hand. So we have Ms. Corbett Sanders, Ms. McLaughlin, Ms. Tolan, Ms. Sizemore-Heiser, Ms. Cohen, Ms. Keith Gamara, Ms. Marin, Ms. Pekarsky, Mr. Frisch, Dr. Anderson, Ms. Lemaish, and Ms. Janet Kofax. That passes unanimously.
That motion carries.
Thank you.
We may have to restate that in our board meeting on Thursday night, but at least Dr. Brabrand has the guidance. So if Ms. Mulder.
Yeah, I don't think you'll need to restate it. You can take a vote in a work session. It's not traditionally done, but it's legal.
Okay, then thank you.
Ms. Mulberg, can you also clarify again that what was read in the Virginia Code is this actually rests with the school board's authority, not the superintendent?
I don't know. Laura Jane read the.
Yeah, the code reads that it's our authority. It's not his. We're just giving him operational direction, but we're the ones who can make this decision, and we just did.
That's right, Megan. That's what it said. That's why I supported it. It said with the approval of the local school board or upon authorization by the school board with the approval of the division superintendent. So what you just did means you don't have to have every single one of those teacher requests come to a school board meeting for review. It can come through, it can come to my office for review.
Okay. Well,
so you said it correctly. The school board did just authorize, upon authorization by the school board with the approval of the division superintendent. A teacher may resign after June 15th.
Okay. And Ms. Mulder, we do not need to re-vote for that on Thursday, so I think that is correct. I think we're good here. With that said, are we okay with sending emails to Ms. Mulberg with our next steps? She will send that out, the whole document to the board to review, and then we'll send that to our staff for next steps for our next work session. So
thank you, everybody.
Thank you, everybody. I appreciate all your patience and your time and all your hard work.
And this meeting is now adjourned.
Bye-bye.
Thank you guys for leading a really tough meeting. We appreciate all the work that went into it. Yep.
Thank you.
Thank you. Bye.